This is the morning session of the Health and Human Services Committee. We'll be considering 6 bills in a work session, and then this afternoon we'll be having a public hearing. You can watch as well as go to older sessions by going to legislature.maine.gov and looking up under HHS, Health and Human Services. All of these are recorded on our very own YouTube channel. If you're in the waiting room or if you're on the attendee list and you have something you think that we should definitely hear, please put your hand up if we haven't already brought you into the panelist category. As soon as I find my phone, I'll turn it off. We'll be hearing the bills. First will be 606. Second will be 934. Third will be 497. Fourth will be 837 with 760 and 762 at the end. So make sure your name matches with who you are underneath your picture. And we'll proceed to do introductions, starting with Representative Zager.
All right, thank you, Mr. Chair. Good morning, everyone. My name is Sam Zager. I represent District 41 in Portland.
Representative Lemlin.
Good morning. My name is Michael Lemlin. I represent House District 88, Chelsea, Jefferson, Whitefield, and half of Noblesboro.
Representative Stover.
Good morning. My name is Holly Stover. I represent House District 89, including Boothbay Harbor, South Port Island, and part of South Bristol.
Representative Perry.
Morning, I'm Ann Perry. I represent House District 140, which includes the communities of Indian Township, Baileyville, Barron, Calais, Charlotte, Robbinston, Perry, Pembroke, and Pleasant Point.
Thank you. Representative Griffin.
Good morning. My name is Abigail Griffin. I represent House District 102, which is Glenburn, Levant, and Condescate.
Representative Connor.
Thank you, Mr. Chair. Good morning, everyone. My name is John Connor. I represent House District 58, which is part of Lewiston.
Representative Craven.
Thank you, Mr. Chair. I'm Margaret Craven, and I represent House District 59, which is part of Lewiston.
Representative Madigan.
Thank you, Mr. Chair. Good morning. I'm Colleen Madigan. I represent House District 110, which.
Hope you just went to mute. Now you're on mute again.
Yeah. I represent part of Waterville and part of Oakland, House District 110.
Thank you. Senator Moore.
Hey, there we go. Sorry about that. I'm out delivering Meals on Wheels while I'm listening to the committee meeting. Good morning. I'm Mary Ann Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan in Hancock County as well.
Thank you for being here, and don't let us distract you from the important part of the driving.
Yes, sir. I agree.
Representative Meyer.
Thank you, Mr. Chair, and welcome to all who have joined us here today. I'm Representative Michelle Meyer, serving Southern Maine's House District 2, which is all of Elliott and parts of Kittery and South Berwick.
And I'm Ned Claxton. I have the honor of representing the folks in Senate District 20, which consists of Auburn, Minot, Mechanic Falls, Poland, and New Gloucester. So with that, we can then introduce the staff who we're working with today. Ms. Dooling.
Good morning. My name is Erin Dooling. I'm one of the legislative analysts with the Nonpartisan Office of Policy and Legal Analysis.
And Ms. Withy.
Good morning. My name is Carrie Withy, and I'm the clerk for the Health and Human Services Committee.
Okay. So, as I said, let's begin with LD 606, and I turn it over to Erin to walk us through the analysis.
Okay, I'm going to share my screen. Okay, current law LD 606 is an act regarding the child protection system. Current law authorizes DHHS to cooperate and coordinate with other agencies, facilities, or persons providing related services to families and children as part of the department's child abuse prevention efforts. This bill requires the department to provide for communication and information exchange among all entities that are part of the child protection system during every child protective investigation. At the public hearing, you heard that the sponsor had an amendment, and I hesitate to speak for her, but because it was emailed at to the committee, it is public that the sponsor has another amendment that she's putting forward. That I don't know if you'd like me to go over, if the sponsor's here to go over that.
Sure. Yeah, whenever you're ready.
Okay, the department raised some issues based on the original bill as drafted, but that might be something to talk about after we hear what the current proposal is. So the sponsor's amendment that was emailed to the committee proposes to authorize the department to cooperate and coordinate with entities that are part of the child protection system on an ongoing basis. It requires the department to establish and maintain a policy that requires ongoing communication with the caseworker and the entities that are part of the child protection system in order to ensure that a family has adequate access to resources and, to the greatest extent possible, increase the information received by the caseworker directly from those entities related to the ongoing risk and safety assessment of the child. And it requires the department to report back to the committee by March of next year about its implementation of this policy, and the committee would be authorized to report out legislation regarding child protection matters upon receipt of that report.
Thank you for that. Does that bring up any questions for folks in the committee yet? I don't see any. I do see the sponsors joined us. So Representative Hymanson, welcome.
Thank you very much.
Anything else that you'd like to contribute as we begin consideration of your bill?
Yeah, thank you for considering the new amendment. I worked with Deb Dunlap, who works with the community service providers in coalitions, Melissa Hackett, who is the Community and Policy Associate for the Maine Children's Alliance. Both of them are in the waiting room if you have questions for them too. Contributing was also Christine Albieri, who is our ombudsman for the child welfare. I appreciate her input. And this really speaks to concerns that have come through the OPEGA report, the ombudsman, the OCFS required report to the federal government. And it really asks the department to establish and maintain a policy. And they're already doing that. They already have a policy, and I really applaud the strong work of the department to put together policies about that. At the same time, putting this into statute offers accountability in law, that no matter what administration is there, in any administration, they would be required to establish and maintain a policy and report back in order to increase the information received by the caseworkers directly from those entities that are listed in the proposed amendment. So it both honors the work of the department and codifies it so that there is improved accountability.
Does that raise any questions for folks? Thank you for that. I don't see any questions at this point. As I understand it, there were a couple of issues raised, mostly around privacy and confidentiality. Do you want to speak to that?
Sure. So the original language did have an intention that we heard that from the department that might step over privacy. And so this current amendment really asks the department to establish and maintain a policy so that they can do that within the limits of what's legal. If the committee has concerns about that, there's opportunity to put something else in this, adding a confidentiality boundary of some sort. But this amendment really does speak to the department creating the policy.
Okay. We've been joined by Dr. Landry. Good morning, sir.
Good morning. Good morning, members of the committee. Thank you for having me back to join you for a discussion.
So go ahead as in response to the analysis and to Representative Hymanson's comments. Your thoughts?
Yeah, thank you very much, and my thanks again to Representative Hymanson for some of her gracious comments. I do want to point out a memo that I believe was sent late just this morning, I believe, regarding 606. I don't know if all of you have had a chance to review that memo, and my apologies for it coming to you late before today's work session. I did want to, though, make sure all of you were referencing that. It is about a 5 or so page memo that details many of the ways that we have already embedded into our practices and policies communication with all of the individuals and parties that are referenced in this bill. It does raise the question for me, and I'll just speak real quickly to 2 points. It raises the question whether or not these policies and practices, very detailed expectations of communication, meets the intent of the proposed bill, or if we're looking for something yet in addition to all of these mentions and discussions of communication in addition to those. The other thing that I would just simply point out is regarding Section 2 of the amendment of the bill. I think there is some concern on our part about the wording there that indicates requires ongoing communication between a caseworker and the various entities, including but not limited to, and then there's a list: schools, law enforcement, healthcare providers, counselors, therapists, etc. It does raise the question whether or not, in the example here, it requires it, and it says including but not limited to. So all of these, it sounds like, would have to be required entities for communication. We have 50% of the kids that come to our attention, children that come to our attention are under the age of 5. Many of those don't have schools that they attend, of course, and so I'm not sure whether or not we would be in violation of this law if it were to pass, if we in fact don't communicate with the school, if in fact the young child doesn't have a school that they attend because they're an infant or a toddler, using that example. So there might be some technical pieces that we have some concerns with, but from a philosophical perspective, we believe we already have embedded, as you can see in just these 5 pages, many and numerous places of expectations for our staff to communicate with all of the individuals that are referenced in this bill. Happy to take questions or answer more detailed inquiries, but thank you for the opportunity to weigh in.
What I heard as I read through the bill, and I admit I did not have a chance to review your memo because I was in caucus meeting. I didn't hear any real question about the goal of the department in terms of meeting with or sharing information or providing or receiving information from these entities. Just the stipulation that for future administrations with future leaders, is there something we can do to make sure that's happening in a way that it doesn't exist now because it's policy and there's a role for putting it into statute? That's what I heard as the underlying question.
Yeah, I would say from my perspective, when I came into this role, one of the things that we looked at was, in fact, about communication expectations. It is part of our policy. It was part of the policy in the past as well. I think it really gets into a question of practice. And if there are some concerns about practice, practice is, from my view at least, not generally something that is easily legislated. Legislation is really about policy, and when it comes to this policy, I think this policy is clear, and I think the practice of this administration, based on what I've provided to you and the other members of the committee, is also crystal clear. I just don't, from my perspective, don't believe that this is a necessary piece of legislation in order to accomplish the goal that has been vocalized. I think we're doing this. Are there potentially some cases out there that individuals may feel like they didn't get some of the communication that they wanted? There could be, and again, that may be very logically tied back to some issues of confidentiality or privacy. So I just don't see this as necessary as we testified originally on the bill. And based on what I've provided to the committee, I think it's very clear what our practice expectations are as well as what our current policies are.
And some of the pushback we're getting is that, all of us on the committee have lived through some of the, terrible episodes of the prior 5-10 years related to maybe not closing all the loops that could have been closed if there was better direction. I've not heard anybody complain about current practices. It's really, the issue is this satisfied? Are our concerns satisfied by having a policy in place, or does it really need to go to become a statute? Any comments on any of this back and forth? Representative Hymanson?
Well, I'm arguing that it should be a statute because it's important. Understanding that the department is doing this already, and also understanding that it's a practice piece. You can have all the statutes in the world, and if it's really hard to do that, then that's a whole other issue. And it is really hard. This is hard work to get community voices together at the right time to talk about the welfare of a child in a community. Completely understandable. But statute and policy are made by the legislature in order to voice a commitment to some principle, and that's what this is. It's our voice to commit to this principle.
And the way I read the amendment, it was really not in terms, it applied more to people providing information to the department than it did the department providing information to people on that list that Dr. Landy referenced. It's one thing to call up the Department of Corrections and say, any follow-up on this, or some other entity in government and say, what can you tell me about? And I have a release. That's very different than calling up the department, say some other department saying, this is something you really ought to know. And I don't have a release. You can't do that. So am I right in that the most of this is encouraging the department to be receptive to, or mandating that the department's receptive to, and putting in steps for that?
That's the intent.
Okay. All right. Are there other questions of Representative Hymanson or Director Landry? Any other comments? Yes, Dr. Landry.
Thank you very much. I would simply say one piece. If the committee chooses to move forward with this, I would again point out in section 2, possibly reverting back to Amendment 1 language where the wording is encourages versus requires, because it does need to, I think, recognize not all of those entities that are in the included but not limited to list that would be required are not applicable in all cases.
Would you accept language if this was to pass that said as applicable, or if a child is engaged or a participant in any of these settings?
Again, I would recommend that we go back to the language that Representative Hymanson put in the First Amendment of encourages versus requires, recognizing that there also may be some cases where because of a confidentiality, privacy, or potential danger issue that we would not be able to share some of this information or reach out to some of these parties in some of these cases. Again, the language appears to me to be very restrictive in that it requires that communication to all of those parties, including but not limited to that entire list. So I'm trying to be as broad-minded as I can be on this and not put us in a situation where we're potentially going to have to have a potential violation of a statutory philosophical piece here when it comes to the very details of the thousands of cases that we review and work on every year.
Would language, yes, Representative Lemlin?
Thank you, Senator. I just wanted to make a comment. Although I agree that we have areas here that need cleaning up or fixing, I also fully agree with Dr. Landry. This looks like down the road, it can cause a lot of issues for the department. And I'm not willing to put that burden on the department. So as of right now, I'm not to pass unless somebody can clean this up.
Okay, thank you for that. Dr. Landry, what about language that would something to the effect of within the limits of confidentiality standards or something like that? Would that help mitigate that at all?
It certainly would help mitigate that, but however, let me give you an example that may illustrate, and again, and I'll put this from the theoretical perspective. Let's assume for a moment that we're investigating and have ongoing case involvement of a family and a youth, and the youth therapist, the therapist that is working with the youth is also working with perhaps, or the agency is also working perhaps with the family. And let's say that there is some information that the youth shares in a meeting with a counselor that then is shared with the caseworker as allowed by releases. We would have to then be very careful that we're not sharing some kind of information within another therapist that's working with the parent if that concern that the youth is evidencing is about the parent. Or maybe it's in a school setting or whatever the case may be. I think we just have to be very careful with what we share and what we say. And I understand the intent is about information coming to the department. From what I heard in the testimony from Ms. Dunlap and others, it was about they wanted more information from the part of the recipients. And that's why the first statement or the first line in section 2 of the proposed amendment says, ongoing communication between a caseworker and the various entities. So I understand later in that section, it says in order to ensure that a family has adequate access, et cetera, and the caseworker has the increased information. But the second line of the amendment says between the caseworker and these other entities, including that whole list. Again, I'm just trying to be as cautious as I can be because our ultimate job is safety first and foremost. I don't want to put our caseworkers and our staff in a situation where they feel like they may be violating statute at the same time that they need to protect confidentiality, privacy, and protect safety. Mm-hmm. And I know that's not the intent of Representative Hyman. I know that's not the intent of any of the supporters that she has worked with on this bill. But I've got to look at potential unintended consequences whenever we consider legislation.
So next we'll go to Representative Madigan and then to Ms. Dunlap for comment. Representative Madigan?
Yeah, I would just like Dr. Landy to provide some clarification. So your concern in the previous example you cited was that if an agency is serving both a parent and a youth, that there is potential Child Protective Services involvement, that you're concerned about the therapist for the youth and the therapist for the parent sharing information that perhaps the youth doesn't want to have happen.
That already exists. So I'm not talking about those situations. I'm talking about a requirement potentially in this bill that the caseworker would actually have to be in the position of having to share that information or answer questions that a therapist may have, whether they're in the same agency or not. again, because of the required ongoing communication. And I recognize this bill gives the department the ability to craft the policy to meet Section 2. I just have some concerns about meeting the letter of the statute requiring that ongoing communication while also ensuring that we're protecting all the confidentiality, privacy, and safety provisions of situations in the future. I think we just have to be very careful about that.
I agree that I think we have to be careful. As someone who's been the therapist for youth and a therapist for a parent involved in cases like this, I think that the expectation as being a provider at times has been that a caseworker may ask me for information. But as the provider, I'm not entitled to them to share information about the ongoing case, about any disposition of the case, or about other people's confidentiality, other patients' confidential information. I think that's the expectation in practice. I mean, I don't know that. I just think that's the nature of the game. If you have information to give and it's mandated, as a provider, that I think we've always dealt with caseworkers who don't necessarily share information that I would or any provider would have any right to because of confidentiality.
And I appreciate that, Representative Madigan, and you're very good at what you do. Unfortunately, there may be lots of others who don't share that same perspective and understanding that you do. And I think that's what I'm not talking about, those that have that clear line and understanding as you do in your own practice. There are lots of others out there that don't necessarily feel the same way and can sometimes, I could see, again, theoretical unintended consequence saying, no, you have to share this information for me because this bill requires you to share this ongoing communication. We would still refuse to do that, but I don't necessarily want to put our caseworkers and our supervisors in the position of having to deal with that.
Thank you.
Okay, you've been listening to this, Ms. Dunlap. Do you have something that you can contribute to the conversation?
Yeah, thank you for having me in and allowing me to speak. And I think Representative Hymanson really covered this well, that part of the intent, we heard the feedback in the last during the testimony that there were concerns about the limits of confidentiality. And so the amendments really are designed so that it's really OCFS that will be responsible for making sure that the policies are working within the limits of confidentiality. And maybe that's something that needs to be stated more clearly in this amendment. I think that's part of what we were working at and that Aaron advised on, but certainly if there's a need to get something more clearly in there, I think that's a possibility. But again, just going back to sort of the intent of this bill, there's no one here who disagrees that this is an essential part of casework. The department already has multiple pages of current policy that this is important. It's well known nationally, internationally as a best practice that there's no one person that has all of the information about a family that needs to happen. And we've seen that result in some tragic situations. I have also, as a community practitioner, seen it result in amazing situations where families are able to really get the supports that they need. Kids are kept safe and free from harm, and that interventions happened that wouldn't have happened if it were just the department operating on their own. And so really the intent of this is to give the core of the policy writing to OCFS to make sure that we're not outside any of these concerns that Dr. Landry is citing, but that really to deal with an accountability mechanism. We know the policies exist. We also know folks in the field report regularly that they have a hard time getting information that they need to get into the department, to that caseworker in a timely manner. And so that's where this is coming from, is really about getting that sort of accountability mechanism in place for something that we all agree is just best practice and good for kids and families.
Could you just briefly speak to your role and how you happen to be here participating?
Yeah, so I'm the former regional director of community partnerships for protecting children in Southern Maine. When those were under my position was one of the ones under the state contracts. And so I'm no longer in that position, but I continue to be connected to all of the community providers. There are still about 600 folks in the southern part of the state who also communicate regularly with folks in the Bangor and Lewiston regions. And although I'm here in my capacity as a private citizen at the moment, I'm also the citizen co-chair for the Maine Child Welfare Advisory Panel, which is Maine's citizen review panel.
Okay, thank you for that introduction. So there are a couple different ways we can go with this. Yes, Representative Meyer.
Thank you, Mr. Chair. I would move to table 606.
Is there a second for that?
Second.
It's been moved and seconded. Did I see your hand, Representative Connor? Yeah, so it's been moved and seconded. So we'll go now to Ms. Withy, and she can poll the committee to make sure that the motion on the floor to table is passed or not.
Representative Zager. Representative Zager is absent. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci. Senator Baldacci is absent. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner. Representative Javner is absent. Senator Moore. Senator Moore is absent. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 9 yes, 4 absent.
Okay, so that's been tabled. Are there any directions that we would like to give to Ms. Dooling in anticipation of a future work session? Any other things that you need from us?
I'm happy to work with whoever needs me to work with them. Just reach out.
So it sounds like Representative Hymanson, you might be in line for some conversations with Aaron and the department and trying to iron out some of the language.
Yes, and thank you so much for this discussion. We'll take it all in and come up with something that addresses your concerns.
Thank
Both
you
the
for being here.
department and the committee.
Thank you for being here.
Thank you.
All right. So let's go to 934. LD 934. Oh, Representative Connor.
Thank you, Mr. Chair. I spoke with the bill sponsor this morning and they asked me to give a quick statement and then make a motion on this if you would permit me.
Sure.
The bill sponsor had said that even though they feel that this bill is very important, due to the current logistics in the legislature at this session, she has asked me to make a motion ought not to pass. So that's what I am doing now. I make a motion ought not to pass.
I would second that.
Is there any discussion of that motion? Thank you for bringing that forward, Representative Connor. I don't see any discussion, so we can go again to Ms. Withy.
Representative Zager. Representative Zager is absent. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci. Senator Baldacci is absent. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor,
Yes.
Representative Connor, yes. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan,
Yes.
Representative Madigan, yes. Representative Javner. Representative Javner is absent. Senator Moore. Senator Moore is absent. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 9 yes, 4 absent.
For those of you who have joined us to watch or listen, it's not unusual at this point in a very busy calendar to have lots of people with multiple obligations to multiple different committees. Senator Baldacci's been in and out once already, and he's back again from one of his 2 other committees this morning. Welcome, Senator. You want to introduce yourself?
Oh, thank you, Mr. Chairman. I'm Joe Baldacci and State Senator from Bangor and Herman, which is Senate District 9. Thank you.
All right.
I don't think I got a chance to vote, Mr. Chairman, so I'm happy to.
Okay, so the last motion on the floor was on 934,
Mhm.
and the motion was to table.
Oh, okay.
No,
It was ought not to pass.
I'm sorry, ought not to pass. I'm sorry, I'm mixing up yeah. The last motion on the floor was ought not to pass on LD 934. Thank you, Ms. Withy.
Okay, I will cast a yes ballot as well. Thank you.
Thank you. Sorry about that confusion. All right, so that would take us to LD 497.
Do you want me to go through my bill analysis on this bill?
If you would, unless there is, yeah.
LD 497 is an act to strengthen supports for families and children through a child abuse and neglect prevention and early education, intervention program. This bill is emergency legislation, meaning it would require 2/3 vote in both chambers, but would take effect immediately. It would establish a prevention and early intervention program by contracting with an organization that provides an alternative response program in the state. The sponsor indicated in her written testimony at the public hearing that she was working on an amendment. The department raised a number of issues relating to the bill as drafted, which we can return to, I think, depending on what the amendment shows. The fiscal impact hasn't yet been determined on the bill. And then for additional information relating to our alternative response program, I provided the information from the committee's budget report back memo.
Representative Madigan?
Thank you, Mr. Chair. I'm continuing to work on an amendment, so I request that we table this while I complete that.
So there's been a motion to table.
Second.
LD 497
I'll second that.
and a second. So back to you, Ms. Withy.
Representative Zager. Representative Zager is absent. Representative Lemlin. Representative Lemlin is absent. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner. Representative Javner is absent. Senator Moore. Senator Moore is absent. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. And I'm sorry, I see Representative Lemlin has joined us. Representative Lemlin, would you like to vote?
Yes, Anna, yes.
Representative Lemlin, yes.
So before we go on to the next bill and seeing Dr. Landry still with us, can I ask a clarifying process question, internal process question? In reading your testimony related to 497, I was confused a bit about reports. Reports is used a couple times from mandated reports and to the department. I don't understand the distinction in those. I think there's two different reports or two different reporting steps.
I'll try to answer that question, Senator Claxton. So when we use the term reports and you hear the term mandated reporter, generally what we're talking about there are reports of suspicions or concerns specifically related to abuse and neglect. And so there's a significant amount of training that happens with mandated reporters, including school personnel, where information is provided to them on what to look for as far as potential signs of abuse or neglect, and how they go about actually making that report. And so that is what we consider a report of suspicions of abuse and neglect. I believe your question was regarding my comment about the bill as it relates to the eligibility section being the way that we read the current bill, and understand, of course, Representative Madigan has indicated an amendment may be coming. But the way we read this bill currently is even when that reporter doesn't have concerns about abuse or neglect per se, but they have concerns about the family or the child, that would be now an avenue, or this would be a program that would be established to for referral for those individuals.
What you're addressing is specific to the bill, and I think with that tabled, we should save that conversation for later on.
Sure.
Mine was really about an internal process that I didn't understand.
Right.
Thank you.
So that's what we call a report. And so many of the information that you will see us refer to is number of reports. What we're talking about are those reports, calls, or information shared about suspicions of abuse or neglect.
All right. And at that point, there's some sort of follow-up. And if it raises to a certain threshold, there's an official report of the department or to the department.
Right. There's always that official report. So the report always comes in. There's an assessment made as to whether or not to follow that up with an actual assignment for an assessment or investigation. That's the next step, would be the assignment or for an assessment or investigation. So you'll see actually the number of total calls that come in the hotline, for example, the number that were reports of potential abuse or neglect, and then a subset of those are the assignments for assessments and investigations.
Okay.
And then ultimately a further subset where the assessment or investigation led to a finding, a substantiation, for example, of abuse and neglect.
Okay. Thank you. That explains that process. It's a little bit in the weeds, but I want to understand. Okay. So that takes care of 497. So let's go to LD 837.
So I'm going to share my screen, but this bill analysis has all three of the department bills on it. So I'll just go through them that way. You didn't have any follow-up information, so I thought this was a more streamlined way to just have a one pager in front of you. LD 837 adds child sex trafficking by any person, regardless of whether or not the person is responsible for the child, to the definition of abuse or neglect, which is within the child protection statutes. It also adds a definition of child sex trafficking that would be cross-referenced by the abuse or neglect definition. The fiscal impact on that bill hasn't yet been determined. LD 762 is generally about truancy. It also amends the definition of abuse or neglect by replacing failure to ensure compliance with school attendance requirements with the term truancy. And then it cross-references the definition of truancy from the education statutes as evidence of jeopardy in a child protection case. The department proposed an amendment in its testimony at the public hearing to clarify that truancy to rise to the level of jeopardy must be the result of neglect by a person responsible for the child and not simply a child's absence because of COVID or internet problems or what have you. The fiscal impact hasn't came back with no fiscal impact on that bill. The third department bill relating to child protection is LD 760 regarding records disclosure. It authorizes the department to limit the disclosure of records only to those records created by the department in connection with its child protective duties. The department may have other records in its possession from providers, but this would only authorize them to disclose those records that it has created, and that provider records could be sought through a means directly with those providers. The fiscal impact on that bill also came back with no fiscal impact.
Does that analysis raise any questions, comments from folks? What would people feel about combining the three bills into one under LD 837, accepting all the definition requests the way they've been put forward by the each of the separate bills and by the department indirectly? And then we could vote on not to pass on 760 and 762. I think we agree on the definitions, Dr. Landry. Would that be acceptable to you if we rolled them into one bill?
As far as I'm concerned, yes, it's acceptable to us.
Okay, and we'll leave it to Aaron to get the language in the right section, whether it's 4002 or 4008. And Senator Baldacci, did you have a motion?
Well, because I always like efficiency, I will move that recommendation, Mr. Chairman.
Okay.
And ask that we ought to pass as amended on LD 837.
That sounds good. Is there a second?
I'll second.
Second to that. Any discussion? Thank you for that motion. Any discussion of that?
I
With
just
the
clarify that,
understanding it's ought to pass as amended with all the language of 760 and 762, the definitions rolled in.
and also the department's proposed amendment on 762?
Yes. Okay, so it's ought to pass as amended. Okay, Ms. Withy, I don't see any other comments, so we'll go to the vote.
Representative Zager. Representative Zager is absent. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner. Representative Javner is absent. Senator Moore. Senator Moore is absent. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 10 yes, 3 absent.
Okay, and with that, then I would entertain a motion to, for LD 760 ought not to pass.
So moved.
Second.
Any discussion about that? Too bad we can't be super efficient and vote on 2 at a time, but rules require that we have Ms. Withy earn her salary, inadequate though it may be. Go ahead, Ms. Withy.
Representative Zager. Representative Zager is absent. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci,
Yes.
Senator Baldacci, yes. Representative Perry,
Yes.
Representative Perry, yes. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor,
Yes.
Representative Connor, yes. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan,
Yes.
Representative Madigan, yes. Representative Javner, Representative Javner is absent. Senator Moore, Senator Moore is absent. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes. That's 10 yes, 3 absent.
And next, I'd entertain a motion ought not to pass on LD 762.
So moved.
Second.
As soon as you're done writing, Ms. Withy, you're up again.
Representative Zager, Representative Zager is absent. Representative Lemlin,
Yes.
Representative Lemlin, yes. Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci,
Yes.
Senator Baldacci, yes. Representative Perry,
Yes.
Representative Perry, yes. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor,
Yes.
Representative Connor, yes. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan,
Yes.
Representative Madigan, yes. Representative Javner, Representative Javner is absent. Senator Moore, Senator Moore is absent. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes. That's 10 yes, 3 absent.
Thank you very much. So as I understand it, that concludes this morning's agenda work session. We'll be reconvening at 1 for public hearing. Before we adjourn, is there anything from Ms. Dooling we should be aware of or any next steps? At that point, I'll entertain yet another motion, this one to adjourn until 1.
So moved.
Second.
All, I heard it seconded. All those in favor? See you at 1 o'clock. Thank you for being here, Dr. Landry. Thank you for your help.
We are on break until 1.
I just saw that. Thank you.
Okay. Have a good lunch. Long lunch.
You look safer in your living room, Senator Moore, than you did in the car.
I am, and I'm jumping back and forth between Zoom and YouTube because I still haven't testified on my bill yet. And just got off of the Behavior Caucus along with Representative Zager and Madigan. So it's been a hop, hop, hop all morning.
I'm familiar with that concept, and I have to testify tomorrow, and I'm still writing like mad. So
Yeah, I was writing at 11 o'clock last night doing the test ready for today. I understand.
nothing like a nice relaxing lunch with 18 emails and 17 texts and a phone call or two thrown in.
I'm wondering if
Then we wonder why we have indigestion.
I'm wondering if I'm permitted to register votes from a work session during a hearing. When Carrie.
When Carrie.
Yeah, I think at this point we've closed out the work session, and you probably ought to go to the presiding officer.
Okay. Because I'll have to do the same.
Yeah, I think that's the better way to do it.
Okay.
1, 2, 3, 4, 5, 6, 8. Well, knowing that other people are likely to be tied up in committees and how crazy the schedule is these days and the crunch time in the legislature, why don't we just go ahead and get started? So let's go around the table and introduce ourselves, the proverbial table, and start with Representative Zager.
Thank you, Mr. Chair. Good afternoon, everyone. Sam Zager, District 41 in Portland.
Representative Lemelin.
Good afternoon, everyone. My name is Michael Lemlin. I represent District 88, Chelsea, Jefferson, Whitefield, and half of Noblesboro.
Representative Stover.
Good afternoon. My name is Holly Stover. I represent House District 89, including the towns of Boothbay Harbor, Southport, Edgecombe, West Port Island.
That will be $5, Representative Perry, after you introduce yourself. We'll skip Representative Perry and go to Representative Craven.
Thank you, Mr. Chair. Good afternoon. I'm Margaret Craven, and I represent House District 59, which is part of Lewiston.
And Representative Meyer.
Thank you, Mr. Chair. Good afternoon, and thank you all for joining us this afternoon. I'm Representative Michelle Myers, serving Southern Maine's House District 2, which is Elliott and parts of South Berwick and Kittery.
Representative Madigan has joined us.
Good afternoon. I'm Representative Colleen Madigan, and I represent House District 110, which is part of Waterville and part of Oakland.
We'll come back to Representative Perry when she returns. We're joined by our analysts. I believe Ms. Broom is here. Welcome.
Hi, I'm Anna Broom. I'm one of the legislative analysts for the Health and Human Services Committee, and I work in the Nonpartisan Office of Policy and Legal Analysis.
And our clerk is Ms. Withy.
Good afternoon. My name is Carrie Withy, and I'm the clerk for the Health and Human Services Committee. If you need any assistance during the hearing, please feel free to email me at hhs@legislature.maine.gov.
And my name is Ned Claxton. I represent Senate District 20, which consists of Auburn, Minot, Mechanic Falls, Poland, and New Gloucester. So we'll get starting with the Yes, Senator Moore. Hi, how are you? Go ahead, Senator Moore.
You forgot about me. No. Good afternoon. I'm Mary Ann Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan in Hancock County as well. Thank you, Senator Claxton.
My apologies. I got messed up by the empty chair. All right. So if you want to watch this recording later on or want to watch audio and video, you can go to legislature.maine.gov, look for the Health and Human Services YouTube site that's on our committee website. And we'll be hearing testimony this afternoon in the following order. We're going to start with LD 488. Then we're going to do 968, 1262, 1147, and 592. That'll be the order of the 5 we'll do this afternoon. So I do remind you that we need to have you identify yourselves correctly under your photo in Zoom as you come into the panelists room. And if you leave afterwards and go to the YouTube to watch, that would be helpful. We have lots of written testimony. I did notice that a bunch of it was pretty short and sweet. What we're looking for from people offering testimony is what makes your particular information important for us to know. We're going to be introduced to the statistics, I think, pretty reliably by the bill sponsor and by the first couple of folks, and we really do not need to hear those same statistics again and again. What we really care about is your story, if you'd care to share it, or your perspective as you share it. And we'd like to limit that to 2 minutes today, given the number of people who are signed up. So I ask you to bear with us while we try and work through a long list of people interested in testifying. So that will conclude the opening remarks, and we can go right to LD 488 and welcome Senator Maxman.
Thank you, Senator Claxton, Representative Meyer, and honorable members of the Health and Human Services Committee. My name is Chloe Maxman. I represent Senate District 13, which is all of Lincoln County, except for Dresden, plus Washington and Knox County, and Windsor and Kennebec County, a total of 27 towns. Thank you for the opportunity to present LD 488, a resolve to expand recovery community organizations throughout Maine. This bill aims to ensure that every county in Maine has a recovery community organization. A recovery community organization, an RCO, is an independent nonprofit organization led and governed by representatives of local communities of recovery. A recovery community center is operated by a recovery community organization, and in simple terms, is the recovery community's home. Lots of different terminologies. More specifically, recovery community centers are a safe space for people in or seeking recovery from substance use, support multiple pathways to recovery, and provide 3 key things: peer-based recovery support services, public education, and policy advocacy. Recovery community centers act as connection centers for people in recovery, to recovery coaches, self-help groups, yoga education, employment, and multiple pathways to recovery. They are a unique model in a state that is suffering from the daily tragedies of the addiction crisis and problematic substance use. In 2018, the Portland Recovery Community Center, the PRCC, who you will hear from today, was named the statewide recovery hub and received funding from the Maine legislature through DHHS to help develop and promote local recovery community centers throughout Maine. PRCC helped open 7 new recovery community centers: Aristic Recovery Center of Hope, Harbor Pier and Wellness Center, Down East Recovery Support Center with 2 different locations, Lake Region Recovery Center, Roads to Recovery Community Center, and Bath Recovery Community Center. And so these places were able to open their doors. The existing Bangor area recovery network joined this statewide network of centers in 2019. During these early days, there was only so much funding available, and hard decisions were made to focus all of the funding into rural Maine, leaving out many urban areas and rural counties. DHHS, Gordon Smith, and networks of recovery communities have worked to find other sources of funding or volunteer support to open more centers. In 2020 and 2021, an additional 4 recovery community centers have or are working towards opening. Those are the Coastal Recovery Community Center, the Larry Labonte Recovery Center, Peer-to-Peer Recovery Center, and the Rest Center. So that means there's a total of 13 recovery community centers across the state, but they're spread over only 9 counties. So this bill is trying to ensure that the remaining 7 counties, Kennebec, York, Waldo, Hancock, Franklin, Somerset, and Piscataquis have access to these services too. This resolve asks for $1 million in grant funding to be directed to DHHS. This specific number was chosen from conversations with a coalition working to open a recovery community center in York County, and you will hear from those folks today too. They provided a copy of their draft budget that showed a year's worth of expenses for a recovery community center at around $130,000. So that number was used to extrapolate the expenses of 7 centers. I've attached a copy of that York County Community Center budget to my testimony. In further conversations with recovery communities and DHHS, I have become aware that there are different levels of financial support that different types of recovery community centers need, anything from hundreds of thousands of dollars a year to smaller $50,000 startup grants, depending on the services that are being provided. I've also heard concerns that requiring the department to provide this funding in an expedited manner may cause an undue burden on the department and unintended consequences to the recovery community. For these reasons, I would be open to an amendment of the bill to provide more time for the department to send out their requests for proposals. I am also not specifying exactly how much each county must receive in this resolve because it is best to leave those negotiations up to the communities who will receive this money and DHHS. What's more, some counties are currently more ready to receive these funds than others, and we are working with the committee on the best way to ensure that Mainers have the support that they need. I do recognize that this is a large ask in a year of such budget uncertainty, but this is the most important time to fund recovery community centers. In 2020, we lost 502 Mainers to accidental overdoses, a 25% increase over the year before. Our Attorney General, Aaron Fry, Governor Mills, treatment providers, and grassroots advocates point to increased social isolation caused by the pandemic as the root cause of the increase. As we turn the corner on this dark time, the recovery community will need places to come together, heal, and connect. That's what this bill would fund. It's also important to note that Governor Mills recently released an updated opioid response strategic plan outlining 5 focus areas, 9 priorities, and 20 strategies, all focused on one goal: to reduce the negative health and economic impacts of substance use disorder and opioid use disorder on individuals, families, and communities. Priority 1 is to build and support recovery-ready communities through a strategy of increasing community-based services by providing funding for additional community-based recovery centers. So this bill is very much in line with our governor's plan and would help her meet those goals much sooner. Lastly, I wanted to say that this bill is a direct request of the recovery community. I am merely the conduit. I will let their stories and expertise guide the conversation today. In particular, I point you to Courtney Allen at the Maine Recovery Advocacy Project, as well as Leslie Clark at the Portland Recovery Community Center. You will also hear from many Mainers about the impacts that these centers have had on their lives, but there are also 7 counties without them, and you'll hear from folks who do not have access to this vital support service. So thank you for your time, and I'm happy to answer any questions.
Thank you, Senator Maxman. Are there questions for her? I don't see any questions from the committee, so thank you for bringing this before us. And we'll proceed with some of the other folks who'd like to testify, beginning with Representative Gear. Welcome.
Thank you, Mr. Chair. Can you hear me?
We can.
Great. Good afternoon, Senator Claxton, Representative Meyer, and distinguished members of the Committee on Health and Human Services. I'm Representative Tracy Gear, and I represent House District 9, which is Kennebunkport, and Coastal Biddeford and Kennebunk. And I live in Kennebunkport. According to the most recent Maine monthly overdose report, in January and February of this year, 11 people lost their lives to overdose in York County, representing 11% of Maine's total overdose deaths during this time period. In 2020, York County accounted for 15% of total overdose deaths. Despite this clear evidence of the substance use disorder crisis, there is currently no recovery community center in York County. As Senator Maxman mentioned, you'll hear more about the needs in York County and the plans that are already in the works. I think overall we are learning every day about what it takes for people to persevere on a path of lasting personal and behavioral change. And one of the key components is a community that provides connection, caring, and role models for change. The RCOs are helping people in many parts of Maine make and keep the connections that help them sustain their recovery through difficult times. We need to expand recovery community organizations to all parts of Maine where they are needed, including York County. I ask you to vote ought to pass on LD 488. Thank you, and I can take any questions.
Thank you for your testimony. I'm not seeing any questions, so we'll thank you for juggling your schedule to get here.
Thank you.
And I understand that Representative Poirier is juggling schedules too.
Thank you very much, Mr. Chair. I am. And I've submitted my testimony, so I'm not going to read it all in its entirety, but I do want to thank you all for allowing me to speak on LD 488. Senator Claxton, Representative Meyer, and members of the Joint Standing Committee on Health and Human Services. My name is Jennifer Poirier, and I represent House District 107, which is comprised of Skowhegan and part of Madison in Somerset County. We are one of the communities that does not currently have a community organization for recovery, but we do have a great need. One of the bits of my testimony that I do want to touch on is the fact that our county jail system is overrun by inmates in need of services like this before they actually reach the judiciary system. When I was elected, one of the first people that reached out to me was Dale Lancaster, Sheriff of Somerset County. And I was just taken aback when he told me that the majority of inmates are receiving services in the jail to support them through substance abuse disorders, and that our jail system has become a treatment center in essence, and that they are actually taking inmates upon release to physicians when they are released so that they can get treatment. And when I heard about this bill from Senator Maxman, that really struck me that we can be helping these people in need before they hit the judicial system, giving them an opportunity to seek help before, crimes are taking place, and saving taxpayers money. That, our jails should not be treatment systems. We should be helping the people of Maine before they hit bottom and need to resort to crime. So that's a real big thing in Somerset County and throughout Maine, and expanding recovery centers, particularly these peer centers, I think is crucial for all parts of Maine. I did not co-sponsor this bill lightly. I was very hesitant at first because I didn't know what it was all about. And I took the time to meet with people, and I participated in Zooms, and I was able to see what it actually accomplished in the centers throughout the state that do have the availability, and just hearing the success stories and the good that they've done. I really want to see this happen in my community and others throughout the state. The positive impact it's had is something that should be available to anybody in our state. So I really hope that this is something that we can all support and actually advocate for throughout any community in Maine, because it's up to us to make a difference and show everybody that they deserve a chance and they can be a positive part of our communities regardless of mistakes that they've made. Everybody deserves a chance, and I hope that's what everybody can take away from this. And I thank you for your time, and I'd be happy to answer any questions that you might have for me.
Thank you for that testimony. I'm not seeing any questions from a committee that's not reluctant to ask questions. So I think that'll conclude that portion. Before we move to the next testimony from Mr. Sarbeck, I see that we've been joined by Representative Griffin.
Good afternoon. My name is Abigail Griffin, and I represent House District 102, which is Glenburn, Levant, and Cadescag.
And Representative Perry.
I apologize. My phone rang, and for some reason, my phone was off, but the computer rang. And then somebody was at my door at the same time, so I had to run. So hello, good afternoon. This is what working at home does. I'm Representative Ann Perry. I represent House District 140. And I represent 9 communities along the St. Croix River.
And what she didn't tell you is that if her phone goes off, if one of our phones go off while during a committee hearing, the $5 contribution to the cookies and candies and junk food will catch up with you eventually. Mr. Sarbeck, please join us for your testimony.
Thank you for having me, and I will make sure my phone is off because I can't afford that $5 donation right now. I'm Jonathan Sarbeck. I'm the district attorney here in Cumberland County. I'm a resident of Cape Elizabeth, and I'm here in support of LD 488. Senator Claxton, Representative Meyer, members of the Health and Human Services Committee, I really appreciate you taking the time to hear this bill and hear from the testimony. I did submit something written, so I would hope that you would just take a look at that. And I'm going to try to be brief today because I really want you to hear from people in the recovery community, because I think that those are the important voices that you need to hear from, because they have that lived experience about how important these recovery community centers are. In Cumberland County, we're very blessed to have 2 very prominent recovery community centers, one in Portland and one in Lake Region. Both of them provide vital services to individuals in the community, the recovery community, and their families. We've seen what these can do to help people stay out of the criminal justice system and really keep people on that road to recovery, which is where we need people to be. And I think that the models that we've seen in Cumberland County work. And I 100% support, along with my fellow district attorneys, the expansion of those throughout the state, because we know that this substance use disorder, the opioid epidemic, methamphetamines, these are things that have reached throughout the state, and we need to have those support systems be more prominent in every county throughout the state of Maine. I'd be happy to answer any questions that people might have.
Thank you for your testimony. Representative Craven?
Thank you, Mr. Chair. I know that so I would love to have a map of the existing programs, because I know that Senator Maxim said where they were, but I couldn't figure out in my head how close to Androscoggin County or Lewiston one would be. And the other thing is as well, whether there are culturally sensitive programs that are available for people, in the immigrant communities.
I believe there are some. That's something that I know a lot of these recovery community centers take very seriously, and they try to be as open to as many people as possible. But I would hope that members would be able to answer those questions for you.
Thank you. So any other questions? I don't see any. Thank you again for being here. And now that we've been through the elected officials, we can go to Mr. Boyce. Welcome, sir.
Senator Claxton, Representative Meyer, and esteemed members of the Health and Human Services Committee. My name is Reverend Dr. Al Boyce, and I am testifying in support of LD 488 on behalf of Volunteers of America, Northern New England. Volunteers of America is a statewide nonprofit and faith-based organization dedicated to serving those in need. VOA has advocated for human rights and social justice for disenfranchised citizens since its inception in 1896. As chaplain for Volunteers of America, Northern New England, and resident of the town of Vassarboro, I urge the passing of LD 488. I personally grew up in a middle-class family from Northern Maine with a stellar work ethic. I'm a spouse, father, and grandfather. I completed a master's program at an Ivy League university and a PhD in psychology later in life. I am also a recovering alcoholic. I stand before you to report that despite the best of rearing and a life filled with goals to serve the human family, addiction can rob anyone of their dreams and the hope for a life filled with meaning. When it became obvious addiction had taken over my life, I attended 3 of the best rehabilitation centers in the nation and sought the best counselors available to me. But it was a community of fellow sojourners in recovery that truly saved me and guided me back to fulfilling and restored life. For the sake of residents all across the state, I urge this legislative body to pass LD 488 so others like myself will have a chance of survival and a restored life. For the past 15 years, Volunteers America has offered residential treatment to persons with dual diagnosis of mental health disability and substance abuse disorders. Additionally, in 2020 and in the midst of the COVID pandemic, Volunteers America opened our first recovery residence program, Twilight Drive Recovery House in Scarborough. Recovery community centers offer persons with alcohol or substance use disorders and their loved ones a critical lifeline to resources, treatment options, and most importantly, a non-judgmental community. Expanding recovery community centers to counties in Maine that lack those resources, we believe, will create a nurturing network of support that is needed in Maine. As a social service and faith-based movement, VOA knows that the recovery
30 seconds, Dr. Boyce.
Thank you, is rarely linear or easy, and all is needed to help and sustain as we move forward. I submit that recovery centers should be a foundational element of each county's public health response to substance abuse disorders. Thank you for your public service to the citizens of Maine. Thank you for considering my remarks in support of LD 488. I'm happy to answer any of your questions.
Thank you, Reverend Boyce. Are there any questions? I don't see any. Then now we'll go to Ms. Anderson.
Hello, my name is Eliza Anderson, and I'm a recovery ally. I'm a senior at Colby College, and I'm looking for the Maine Drug Policy Lab. And I'm here today to read testimony for Susan Parks, who could not be present. So good morning, Senator Claxton, Representative Meyer, and distinguished members of the Health and Human Services Committee. I'm reading for Susan J. Parks, who lives in Augusta, Maine, writing in favor of LD 488. The reason I'm in support of this LD is because I have had direct experience with a former neighbor friend who had a substance use disorder with opioids, and despite the help of his family and neighbors, died of an overdose. In the winter of 2018, a new family moved in across the street from me. A month or two later, a lot of late night car traffic at the family's home gave great concern to the neighbors, who contacted the police and began submitting anonymous tips to the Augusta Police Department. The neighbors, including me, speculated that the traffic had to do with illegal drugs, since the visits were quick, with the car left running in the driveway and individuals leaving the home with small packages. In February of 2019, an attempted murder occurred at the home. The police were not called. The injured person was dropped off at Maine General, and when the hospital saw the wound, they called the APD. By the time the APD arrived in our neighborhood, the house, which we believed was a trap house, had been cleared of any drugs. The ongoing late night car traffic at the home and the attempted murder terrified our neighborhood. We met with an APD police officer in charge of the case and were told the APD had their eyes on the drugs for probable cause to search the house. The neighbors continued to provide anonymous tips. As another tactic, the neighbors decided to meet with the owner of the home. We learned a lot about the history of the tenant's substance use disorder and his near death from an overdose a year earlier. One of the neighbors shared that an Augusta-based program, Young People in Recovery, might be something we could offer to the young man who had the substance use disorder. I called him and began giving him rides to the YPR meetings each week. I attended the meetings with him and learned a lot from the other attendees. The situation became hopeful when my neighbor friend began engaging with other members and obtained their contact information. He told me he didn't need rides to meetings anymore because other YPR members with whom he'd made contact were giving him rides. I thought things were going well for him, and I didn't check on him regularly. Sadly, the upswing in his recovery didn't last long. The opioids, his cerebral need for the opioids, and his isolation took hold of him. He died of an overdose several months later, much to the heartbreak to his family, friends, and neighbors. Naturally, we asked ourselves, what more could I have done to help him connect with him? If Augusta had a RCC when my neighbor friend was
30 seconds, Ms. Anderson.
Thank you. He might be alive today. The support, the safe place, the camaraderie, the connections, and the one-stop concept of RCC might give him the chance in his recovery that a once-a-week meeting at church couldn't. The opposite of addiction is connection. Thus, I'm in favor of LD 488, encourage you to pass it. She is happy to answer any questions at the end of her testimony. Thank you.
Thank you for that testimony. I don't see any questions, so we can go. I will just remind everybody that we're really shooting for 2 minutes on the testimony, wanting to hear the stories that make your testimony unique. That we didn't include Representative Griffin in that reminder, so we've been going a little longer than ideal, so we'll try and be a little flexible, but we have a lot of people who'd like to testify and 4 other bills to hear. So now we'll go to Ms. Clark.
Good afternoon, Senator Claxton, Representative Meyer, and distinguished members of the Health and Human Services Committee. My name is Amy Clark. I'm a resident of Brewer, chair of the board of directors at Bangor Area Recovery Network, and most importantly, an affected other. I stand before you today in support of LD 488. When I first walked into the barn 3 years ago, I had no idea what to expect. I knew that I wanted to support other families like mine, but I really didn't know how that would be possible. I didn't have any special training or know much of anything about addiction and recovery. I never could have expected that walking into a recovery center would change my life. Volunteering at Barn has given me experiences I never could have imagined, like sitting here with you all. Over the last few years, I've been able to help families just like mine with Barn's monthly support group for affected others. I've sat with people as they've shared stories they're too afraid to tell outside the sanctuary of those walls. I've seen the looks on their faces when they realize they're not alone. I have celebrated successes with them and cried tears of deep grief with them. I've had the opportunity to hear so many people in recovery share the stories of how they overcame unspeakable things to beat the odds and turn around and help the person behind them. I've seen firsthand that miracles are real. You can't have experiences like this and not be changed forever. I've learned so much in my time at Barn. Obviously, I've learned a lot about addiction and recovery, but I've also learned about strength and resilience, faith, and hope. I have learned that a person can overcome anything if they want it badly enough, but they need support along the way. No one can do it alone. I've learned that one of the greatest things you can do for someone in recovery is to show that you believe in them, that you love them, and that you're there for them. You all have the opportunity to do this today by expanding access to recovery centers across the state. Supporting recovery is a community responsibility and everyone has a role to play. I urge you to not only please vote in favor of LD 488, but to get involved in your local recovery community as well. You never know, it might change your life too.
Thank you, Ms. Clark, for sharing your story. Are there any questions? I don't see any, but keep up your remarkable work.
Thank you very much.
We're joined also by Ms. Putnam, if you'd like to testify.
Hi, good afternoon, Senator Claxton, Rep. Mayor, and distinguished members of the Committee on Health and Human Services. My name is Chelsea Putnam, and I am a resident of Fulton, Maine, and a person in long-term recovery, which to me means that today I'm a mother to my daughters and an advocate for recovery in my community. About a year ago, I really found myself and my support team by going to the local recovery center, Arch in Holton. Now I work hard every day to better myself and the community I live in. Today, almost 2 years into recovery, I have my own apartment, an amazing job, and I'm part of some amazing organizations, and recently started school for my CADC. Recovery has completely changed my life and has created so many opportunities for me. I also organize with the Maine Recovery Advocacy Project in an effort to ensure people who are directly impacted by the opioid crisis and the war on drugs have a voice in their state and local governments. That's why I'm here before you today. I'm here to testify in favor of LD 488, a resolve to expand recovery community centers throughout Maine. Bringing recovery centers to the counties that do not have them already would make a huge impact in many ways. The number of overdose deaths alone should show how badly these centers are needed. The opposite of addiction is connection, and that is exactly what these centers provide. Communities are built inside these walls, and every day they make room for positive change in people's lives. Without my recovery center, I may not be where I am today. Arch has given me purpose, a support system, and a whole new way of life. As we move forward past this dark time of isolation, now more than ever, the recovery community will need places to come together. Recovery centers are those spaces. Please recognize the needs of people who use drugs, people in recovery, and those affected by substance use disorder. Community centers would make a huge, long-lasting difference for our communities and a step in the right direction. Thank you for giving this time to speak about the centers, because they have given me and many others a place to call home. Thank you.
Thank you for the testimony and being willing to share that story. Good luck in your work ahead. We're also joined by Ms. Allen. Your turn.
Good morning, committee members. My name is Courtney Allen. I'm a resident of Augusta and the policy director for the Maine Recovery Advocacy Project. You have my written testimony, so I will skip over most of it. One of the things that I want to reiterate most today is that LD 488 is a direct ask from the recovery communities across the state of Maine, a community that has been on the front lines of the addiction crisis for decades, taking care of our people. Recovery support services are not a new concept. It has been an integral part of our culture for a long time. More recently, the concept has been formalized, researched, and supported through state and federal funding. We want to thank your committee for your investment in our community during the 128th legislative session, resulting in the 7 centers that you will hear about today, one of which is in Lewiston. We also want to thank Governor Mills, Gordon Smith, and the Department of Health and Human Services for their commitment to our community. They have worked tirelessly to engage us in the process of decisions that impact us, to fund more centers, and by making recovery communities a center a priority in their recently released strategic action plan. We could not have better allies at the state level on this issue, and we are so grateful for you. The last thing that I want to hit on is that the counties that I live in, Kennebec County, and I represent on the city council, is particularly ready for a recovery community center. The city of Augusta, the mayor nominated a task force in early 2021 to look at how we can respond to the opiate crisis in the city of Augusta. My city council unanimously adopted a city
30
goal
seconds, Ms. Allen.
so to support making Augusta a recovery ready community. And we have a strong network of people in recovery and our allies who are committed to ensuring that people in or seeking recovery in the capital of Maine are celebrated and elevated. No matter what happens with this particular resolve today, I am proud of the recovery community for their fierce advocacy on this issue. I am sure that this conversation will continue and we are here for it. I'm happy to answer any questions. Thank you so much for your time today. I know everything is really busy in the legislature right now.
Thank you for your testimony and for your ongoing work. Are there any questions? I don't see any, but thank you again for being here. Now we can go to Mr. Harvey. Welcome. Have you unmuted, Mr. Harvey? Because we're not hearing you yet. Now you're unmuted. We're not hearing you, Mr. Harvey. It's okay that we don't see you, but we need to hear. Oh, there you are. If you're talking, I'm not hearing you. We're not hearing you, Mr. Harvey, if you're testifying. Okay, let's go to Representative O'Neill. Welcome.
Good afternoon. Oops, I'm sorry.
Go right ahead when you're ready.
Thank you, Mr. Chair. Good afternoon, Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee. My name is Maggie O'Neill, and I represent House District 15, which is in Saco. I'm here today as a co-sponsor of LD 488. And as Senator Maxman has outlined, LD 488 would provide grant funding to create a first recovery community organization in the 7 Maine counties that do not yet have one, including York County, where I live. I support this initiative for a few simple reasons. As it's been outlined today, stakeholders have clearly expressed that recovery centers help those in recovery navigate the journey by building supportive peer relationships, sharing community space, and connecting with resources. I want to reiterate that it's a direct ask for the recovery community who is closest to the problem and closest to the solution. Folks leading this work will tell you that ideally every community should have a recovery community organization. This bill is such an important step in the right direction, and it'll help create models for community hubs down the road. Second, where I live in York County, we're ready to take this on. Folks including Kennebunk Police Chief Bob McKenzie, who I think you'll hear from today, have been working so that our county is ready to accept a state grant. I invite you to ask them about their experience that informs their advocacy for recovery community centers and the legwork that they've done so that York County is ready to establish an organization now. And third, establishing these community organizations will help us get closer to where we need to be with peer-led community organizations in every community. You've heard from stakeholders about why these organizations are so important for the connections that folks need throughout the recovery journey. I also want to note that in York County, for example, where I grew up and live now, a lack of transportation can be a barrier to accessing the peer connections that organizations like these offer. With our current transportation network in York County, it's difficult to get from, say, Waterboro to Sanford or to Biddeford-Saco. So for that reason, I wholeheartedly support efforts to establish an organization in Sanford or in the Biddeford-Saco area, where data tells us that we should start. And I want to emphasize that we have a lot of work to do to make sure that everybody can access these peer-led resources in their home communities. Establishing a community organization in each county will help create networks that folks can build upon, sharing experience and expertise to create local recovery community organizations across the state. And finally, I just want to share that I spent 2 or 3 years working on building a sustainable source of funding for folks in recovery. Folks such as Representative Perry helped lead that effort, and I thank you for your help on that. That fund is now in place as the Prevention and Recovery Fund. And based on an update that I received earlier this year that you'll be aware of from Director Gordon Smith, the fund currently has just shy of $2 million available for prevention, harm reduction, and treatment. I believe the bill as drafted would depend on general fund dollars, and I encourage the committee to consider this a further resource in conversation with Director Smith. So thank you for your consideration, and I'd be happy to answer any questions you may have.
Thank you, Representative O'Neill. I don't see any questions. For those of you who are watching the clock, we give the legislators a bit longer on the clock because they represent so many people. So now we'll go to Gary Harvey if he can get back in touch with us. But in the meantime, we'll go to Ms. Markey.
Hello, good afternoon, distinguished committee members. I am Jean Markey, as he stated, from China, Maine. I'm here to support LD 488 to open additional recovery community centers, hopefully one in Kennebec County. A year and a half ago, one very, very dark night, I found my son passed out in a snowbank. Luckily, he got the medical help he needed in time. But what has gone through my mind since that time, ever since, was it didn't have to happen. He had been doing everything right on his road to recovery. He saw a therapist. He went to meetings. He had been sober for several months. Yet he was stuck in place. He couldn't move forward. The days leading up to his overdose, he was dreading his birthday. He was feeling more and more isolated, hopeless, and friendless. A local recovery community would have made all the difference for my son. I'm certain of that. There's no guarantees, of course, but that connection would have really, really helped. He would have had peers who could have related to what he was experiencing and encouraged him when he felt down.
Seconds, Ms. McKee.
Pardon?
30 seconds.
Already. And people like my son need a community center where they feel accepted. They learn how to reclaim their lives and support each other in the journey to recovery. So I ask you sincerely, if you could please pass LD 488, and I'm happy to listen to answer any of your questions. And thanks so much for listening. Bye-bye.
Thank you, Ms. Marquis, for bringing your story and that of your son to this conversation. I can't imagine as a parent going through that, but I hope he's doing okay, continues to do okay. I don't see any questions, so now we can go to John Clark. You're on, there we are.
Good afternoon, Senator Claxton, Representative Meyer, members of the Health and Human Service Committee, all of those present. My name is John Clark. I'm a resident of Augusta, Maine. I'm here to testify in favor of LD 488. I believe all areas of Maine, especially Augusta, should have a recovery center. During my personal journey, I was a client at Wellsprings Men's Halfway House, a residential long-term facility specializing in substance abuse and mental health services. During my stay at their facility, part of their curriculum included Narcotics Anonymous and Alcoholics Anonymous meetings. We were mandated to attend 10 of these such meetings per week. Bangor actually had one of these so-called recovery centers called the Barn, which I'm sure all of you here are familiar with. Bangor Area Recovery Network hosted the majority of our meetings. Going to these meetings became an integral part of my recovery. I suffered from PTSD, substance abuse disorder, and have managed to turn my life around. I'm 6 credits away from testing to be a certified alcohol drug counselor by July. I have the recovery time under my belt because of the network built through the same type of recovery centers this bill is in favor for. Not only a place that's self for recovery meetings, but a place that's safe, warm, shelters people in active addiction or long-term recovery. A place where everybody knows your name, but only your first name. It doesn't judge, doesn't blame, but helps rehabilitate, corrects the character defects that played a major role in our addiction to begin with. Something that creates unity, a loving bond between members or guests. The opposite of addiction is connection.
30 seconds, Mr. Clark.
Destroy them. Thank you.
Was there additional testimony that you wanted to offer, Mr. Clark? You had some remaining time.
If anybody has any questions, I'm open to listen and answer those questions. But it just, it's been an integral part of my recovery since I've been in recovery. And if it wasn't for the recovery center, the Barn, I probably wouldn't be where I'm at today. So that's much what I've got.
Thank you. Thank you for sharing that story. And it's always great to hear about some successes.
Thank you, sir.
What next is Miss Robbins?
Hey there. My name is Katie Robbins, and I am a person in long-term recovery. I also am a recovery coach, and I work at a recovery center. So I'm going to backtrack a little bit. I was in recovery in the state of Connecticut from 2015 to 2019. And in 2019, I did have a reoccurrence of use. And at that point, kind of brought myself out to, you know, what was I not doing, or what was I doing that brought me back to this? And one of the things that I found that I didn't have was a community. I went through rehab, I did everything you were supposed to do, but I didn't have anybody that was in recovery that I could relate to, that I could share with. And at that point, after my reoccurrence, I had come to Caribou, Maine, and been forwarded to Roads to Recovery Community Center in Caribou. I came to this center, and my life just totally changed once I came here. I found employment. I found my husband. We have a baby. I'm in school. I found connection to employment services that helped me get a laptop to go to school, and I'm getting my CADC currently. I bring in custody of children that I lost due to that reoccurrence. I'm an active part of their lives. And more than that, I'm a like good influence on them. And just this center changed my life. Without this place, without community support, I would definitely not be here. These centers mean a lot to us that recover, that use them. And I am so
30 seconds, Ms. Robin.
Thank you. And I am so thankful that I came to a community that had a center and that did the work with the community, with law enforcement, to make this a place where recovering addicts can not only be successful, but flourish. And this is just, everybody needs this opportunity. And I hope that you vote in favor.
Thank you for your testimony, Ms. Robbins. How old is your baby?
She will be 6 weeks on Wednesday.
Congratulations.
Thank you.
Looks like we can go to Gary Harvey, who's joined us from the vehicle.
All right, can you hear me now?
I can.
All right. As you know, my name's Gary Harvey. I live in Augusta. I was addicted to opiates for about 10 years, other drugs. Been clean for 3. CARE program in Kennebec County was a big part of that. Their program there at the jail. Recovery center for me would mean a bunch of things. One, more clean place for people to meet as a high priority nowadays. 2, everyone needs support. Like that's a number one thing in recovery. You need a support system. And a lot of people, you get out of jail system, you don't have that support. Many other people in their life, even though they had a good upbringing, they don't have people in their life that can relate to them. So a recovery center would help with that greatly. It would allow people to have more than just support for addiction. It would just be on a whole nother level of things. It could help people get more jobs. It could do a lot more than that. I don't have any more time than that, but we can all make a decision right now to help somebody. We can't make the decision for them not to get high, but we can have tools for them to use to get back into the community and have a good life. Thank you.
Thank you. Thank you for your testimony, and thank you for being persistent, trying to figure out a way to do that. So now we can go to Lenny Smith. Mr. Smith.
Hi, good afternoon, Senator Claxton, Representative Meyer, and distinguished members of the committee of the Health and Human Services Committee, the Health and Human Services Committee. My name's Lenny Smith. I live in Portland, and I'm a person in long-term recovery, and I've worked in treatment of substance use disorder for over 16 years now, in inpatient settings, in aftercare, as a partner in a medical detox and an IOP, and also providing outpatient services. And I'm here today to say I stand strongly in support of Senator Maxman's bill, LD 488. To open recovery community centers in each of the remaining Maine counties not currently served by one. As you've heard, a recovery community center increases access to recovery for those who need it in the form of hosted support groups, representing any and all paths to recovery available in the region. From the familiar 12-step fellowships to smart recovery to support for people on medication-assisted therapy, support for families and loved ones of people who suffer from SUD, and more. They maintain volunteer staff, telephone support services. They offer recovery coach trainings and certification programs, sponsor stigma-reducing events. For example, in Portland, we have an annual Rally for Recovery, which gives the public a chance to see the recovery community at their best and, come to understand that we're good neighbors, we're great employees, if we're actually working a program of recovery. They host fundraisers and more.
30 seconds, Mr. Smith.
I personally facilitated a support group for loved ones of substance use disorder sufferers for the Family Restored at the PRCC for several years. We've seen that group expand to many, both in state and across New England. Our goal post-COVID is to bring them to every recovery community center in the state. And I think that's the the best message I can give you is by providing a locus for these kinds of services, the vibrancy and the success of an area's recovery community increases exponentially. You know, if you give them a place to do it, we do. And you know, as far as Representative Craven's question, by the way, I don't personally know of immigrant communities having taken advantage yet of one of the recovery communities or recovery centers specifically, but I do know they'd be more than welcome. I know that the peer-to-peer center in the Katahdin region, I think it definitely offers services to the indigenous community up there, and it's just the nature of the recovery community is to say yes. So I strongly urge you to say ought to pass. Thanks so much for your time.
Thank you, Mr. Smith, for your testimony. And we can, not seeing any questions. We can now go to Ms. Ramroop. And we get to see another baby, maybe.
Good afternoon. No baby, sorry. My mom took him so I could do this. My name is Leslie Ramroop. I am a resident of Augusta and a recovery ally, and I'm actually also the sister of Gary Harvey, who spoke a few minutes ago. He's actually the reason that I am involved in the recovery community today. I've been a member of Young People in Recovery of Augusta since 2018. Most recently, during this pandemic, I started hosting the All Recovery meeting at my house on Tuesday nights. My husband and I saw that there was a need for space to host meetings. There was no in-person meetings at the time. The overdose and suicide rates were out of control, and people we knew were relapsing, and they really needed that space. So we decided that even if us providing that space could save one person from overdosing, it was worth us doing it. I'm here today to testify in favor of LD 488 because I want Augusta to have a recovery community center. A lot of people I know in recovery have numbers they can call when they're struggling, but sometimes people cannot always answer. I can't always answer, even though I want to. A recovery community center could be a place people can go when they need to connect with someone. There would be a meeting happening and other peers to help them. The recovery community center could also hold pro-social events like basketball games, game night, dances, and other fun, sober things to do. It could be kind of like a little village for people in recovery. And it could also be beneficial not only for people in recovery, but their families, children of people in recovery, a place for them to connect with others and to get help and support. So thank you for your time, and I hope you pass the bill.
Thank you. Are there any questions for Ms. Ramroop? I don't see any. So again, thank you for being here. Cute baby. Next, we'll go to Ms. Clark. Welcome.
Good afternoon, members of the Health and Human Services Committee and Senator Claxton and Representative Meyer. My name is Leslie Clark, and I am the Executive Director of the Portland Recovery Community Center, the PRCC. And the PRCC, as you've heard today, provides direct support to thousands of people at recovery at our center in Portland, but we also coordinate and work with new and developing recovery community centers throughout Maine. Personally, as a person in long-term recovery from alcohol and drugs, I know firsthand the power of connection with others in order to find and sustain long-term wellness and freedom from addiction. I'm testifying today in support of Senator Chloe Maxman's bill, LD 488, to open 7 additional recovery community centers. I just want to say how moved I am hearing our organized voices of recovery today and the support from this committee and so many people over the last couple of years. To see this happening is just, it's so powerful. Recovery community centers aren't just a nice idea. Recent research from Dr. John Kelly at UMass Harvard demonstrated that people who participate in recovery supports at recovery community centers, especially people in early recovery, experience improved functioning, quality of life, and psychological health. PRCC was included in that study, and today we are also collecting outcome data that shows significant gains that people are achieving all throughout the state of Maine by participating at their local centers and
30
recovery
seconds,
coaching.
please.
You've heard a lot about recovery community centers. I just want to add that, you know, in 2017, we became at PRCC an independent nonprofit. A small group of board members sat around a table and we envisioned that there would be a recovery community center in every community in Maine. Today, there are 13 centers and new ones developing with support from the state to help those 7 first ones. More and more are starting up. There are thousands of people in recovery in Maine and thousands more who are still suffering. Those of us in recovery who've broken our silence to speak out as people in recovery do so only for one reason: to spread hope and share the message that recovery is possible. We know that through community connections, resources, and support, it's not just possible, it's probable. And that's why access to recovery community centers in every county in Maine is so important. Please support this bill by voting to support it. I'm happy to answer any questions, and I would just want to note that we have sent the map that Representative Craven requested showing all of the centers over to Carrie Withy just now. And I would, if you would like to speak to a little bit about the issue of how we are working in the organized recovery community to be more inclusive and work on racial justice and getting recovery support to every population in Maine.
Thank you for those efforts. So I don't see any questions. So thank you for the map. We'll look forward to seeing that. And next we can go to Ms. Paddleford.
Good afternoon, senators, representatives, and distinguished members of the Health and Human Services Committee. My name is Lori, and I am a resident of Auburn and a person in long-term recovery. My recovery began in 2018. It was a Wednesday morning. My friend Angela picked me up. We went to a building on the corner of Water Street in Maine, a building that I had walked and drove by 1,000 times over 20 years. Most of the time, the windows in the front were empty. A few times through the years, small businesses would take up shop, never staying for long. Caribou is the most northeastern city in the US, and that's a fun fact. That morning, those windows showed a glimpse of hope for me. Roads to Recovery Community Center, excuse me, was open and it was bright. It was warm, resourceful, and I felt a sense of belonging. The ladies I met that day became my recovery coaches, my peer supports, my friends. That night, I would return to the center. Angela, my friend, went with me to my first recovery meeting. Walking inside brought comfort to me that I hadn't had in a long time. A feeling of hope. Over the next few days, I would go back daily.
30 seconds, please.
Sitting with my new associations and people who were not using drugs. I was able to do my intake for Crossroads there. I now live in Auburn, and when I return to Caribou, I don't worry about triggers or faltering in my program. I know that I have a safe space and support still at that recovery center. I am before your committee today to testify in favor of LD 488 because recovery centers are vital, especially for newcomers. I hope that your committee will pass this bill and help to ensure the recovery communities are available. Thank you for your time.
Thank you. And thank you for fighting through what's a hard story to tell, but thank you for sharing it. Next, we can go to Attorney Maloney. Welcome.
Thank you. Senator Claxton and Representative Meyer and honorable members of the Health and Human Services Committee. My name is Megan Maloney. I'm the District Attorney for Kennebec and Somerset counties and the President of the Maine Prosecutors Association. I'm here to testify on the behalf of myself and on the MPA in support of LD 488. Maine needs recovery organizations because, as you've heard, the opposite of addiction is not sobriety, but rather connection. I've experienced people coming into people committing minor crimes at the end of their time in a treatment court because of the fear of the isolation that will occur after graduation. Many people would never need a treatment court if they had a recovery community. Let's put our resources at the front end and give people the connection and the help that they need. A recent case on my caseload illustrates the problem. A young man in his 20s was told by his mother he could no longer live with her due to his substance use disorder. The man's father agreed to let his son stay with him as long as he was in recovery. But when they drove to a local hospital, the hospital put him on a waiting list for recovery. While waiting for treatment, the son engaged in criminal activity. Now, in our criminal justice system, he will finally receive treatment, but it shouldn't have to come to that. And it could have been even worse. He could have died like the hundreds of Maine people who died last year, 502 Mainers. We desperately need recovery organizations, and the MPA is proud to support LD 488. We hope that you'll join us.
Thank you, Attorney Maloney, for being here and taking the time to testify, bringing that perspective. Are there any questions? I don't see any. Thank you again. Ms. Shaughnessy is next.
Good afternoon. Can you hear me okay?
We can.
Excellent. Good afternoon, Senator Claxton, Representative Myers, and members of the Joint Standing Committee on Health and Human Services. My name is Mallory Shaughnessy, resident of Westbrook and Executive Director of the Alliance for Addiction and Mental Health Services. And the Alliance is here in support of LD 488. In 2010, the Alliance forerunner, the Maine Association of Substance Use Providers, secured a grant contract from the then Office of Substance Abuse to open the actual Portland Recovery Community Center you've been hearing some about. Along with the barn in Brewer, it was one of the first recovery community centers in Maine. And in its first year, it had over 10,000 visitors, held hundreds of meetings, offered a gathering place for people seeking support in sustaining and thriving in their recovery. The PRCC, as you have heard, and Leslie is a wonderful leader there, has grown tremendously since then, has its own nonprofit status, serves as a hub to the learning around this and creating new centers across the state. And we did seek funding for additional recovery centers back in 2015. More were created in 2017, and more have been founded since then. These are models that are exploding across the country as we realize the need for that human connection, that need for recovery support and assets in the community. So we applaud the administration and their inclusion of recovery community centers as a priority in their recently released 2021 Strategic Action Plan. This bill is a step in that direction. So please support LD 488 and continue to invest in the recovery assets our communities need. With that, I will stop and answer any questions if you have them.
Are there any questions? Thank you for being here, bringing a little historical information with you.
Thank you.
Appreciate it. Next, we'll go to Marshall Mercer. Mr. Mercer.
Hello.
Hello.
Dear Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee. Hello, my name is Marshall Mercer. I live in Washington County and am a peer support specialist and recovery coach working at the Down East Recovery Sports Center. Before I became a recovery coach, I was a member. And before that, I was someone with addictions. Treatment helped me enter recovery, but the Recovery Community Center provided the support resources and, most importantly, the connection that helped me sustain my recovery and the resolve to give it back. Such support is not available to all Mainers. 7 counties are without these essential centers of support and connection. I'm here to testify in favor of LD 488 because it would remedy this unfortunate circumstance by providing funding to establish RCCs in those counties lacking them. In all likelihood, I would not be a recovery coach if it weren't for the RCC here in Machias. In fact, I might not be in recovery at all. I would certainly be more vulnerable to relapse. As it is, I am building on the support I received and passing it on to others. Many of them will do the same. As you can see, this model pays for itself many times over by helping people reach stable recovery. Giving back is something most people in recovery do. Over their lifetimes, they have a positive impact on countless lives who face addiction. RCCs build a foundation on which our most important resources, our people, can rebuild their lives. It is well past time for every county to have an RCC, so the ripple effect of recovery can take place all over Maine. I hope you will pass LD 488. I'm happy to answer any questions. Thank you for your time.
And thank you for your testimony. I don't see any questions. Well said.
Thank you.
Next, we'll go to Mr. Paddleford. If you'll unmute and join us.
Good afternoon, members of the Health and Human Services Committee. My name is Michael Paddleford, and I am a person in long-term recovery. I am just one of the members of the recovery community who come before you today in support of LD 488. In October of 2018, I needed help. At 42 years old, living in Caribou, I had no idea that recovery was even possible or where to get started. I had never met anybody in recovery. The secret societies of the anonymous programs were as much a mystery to me as the Freemasons. Luckily, I was able to find my way to a rehab center in Southern Maine. On the second day after rehab, I was introduced to the Portland Recovery Community Center. I found connection with people who shared my disease. I found a place that showcased all the recovery options available to me. A staff of recovery coaches were there to help me find my way. I found a community of supportive strangers that welcomed me, a place I could feel at home. Had I not found the PRCC that day, I'm not sure how my recovery would have gone. Thankfully, I don't have to think about that. I do, however, think about all those still suffering today without a recovery community center to go to. I think about those people in rural Maine that have never heard of a recovery solution for themselves. I think about all those we've already lost, not knowing that there was a way out. This bill will provide our community with a safe place to connect with our peers, to find a solution for ourselves. It'll provide us a place to receive the valuable help we need in the moment we need it. It will provide us with a place to call home, regardless of where we come from. Connection is the opposite of addiction.
30 seconds, please.
We need to find it somewhere. We're starting to understand what works for ourselves, and it's the connection to other like-minded people that we need most. A place to feel safe enough to access all of the programs of recovery, and a place we can come home to. I appreciate your time today, and I'm available for any questions if you have any.
I don't see any questions, but thank you for bringing your story to this hearing.
Thank you.
Next, we can go to Molly Higgins.
Thank you, Senator Claxton. Good afternoon, committee. My name is Molly Higgins, and I live in Waterville. I am a recovery ally and a senior at Colby College, and I work for the Maine Drug Policy Lab. Today, I'm here to read testimony on behalf of Allison Webb. Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee, my name is Allison Webb, and I am a resident of Portland. I'm a public health professional, a recovery ally, and an affected family member. I am here today to testify in favor of LD 488. Brand new research published in 2020 shows that recovery community centers are an important and evidence-based recovery support service, especially for people in early recovery. Recovery community centers are utilized mostly by people with few resources in recovery from alcohol use disorder or opioid use disorder. They play a unique role in helping people in early recovery gain recovery capital, which in turn improves their quality of life. This means recovery community centers link people to the things they need the most: true connection with peers in recovery, safe housing, and employment and volunteer opportunities, so they can work on getting well and leading the lives they want. Healthcare providers, social service agencies, clergy, and probation officers are always looking for ways to support people in early recovery, and they refer people to recovery community centers which in turn link them to the supports they need. Maine is on the path to building a robust system of recovery support services, and funding recovery community centers in every county in Maine is one of the next steps in this process. I urge you to vote ought to pass. I'm submitting this as written testimony as well. If you have any questions, please feel free to contact me at allison.jones.web@gmail.com. Sincerely, Allison Jones Webb.
Thank you for bringing her testimony, Ms. Higgins.
Thank you.
I don't see any questions. So now we'll go to Ms. Proctor.
Good afternoon, Senator Claxton, Representative Meyer, and distinguished members of the Committee of Health and Human Services. My name is Nicole Proctor, and I'm a resident of South Paris. I have the privilege of serving as director of the Maine Recovery Hub at Portland Recovery Community Center. Thank you for this opportunity to testify in support of LD 488. Through my work at PRCC, which serves as Maine's recovery hub supporting 12 other recovery centers around our state with technical assistance and training, I've had the privilege to witness how these centers have begun to transform their communities. Through public education, peer support, and advocacy, recovery centers are helping to break the stigma associated with substance use disorders and help people find and sustain recovery. In the 1990s, the recovery movement was a growing movement and was a national movement supporting the creation of grassroots RCOs to advocate for meaningful representation of people in recovery, to educate the public and the policymakers, and to help celebrate the multiple pathways and stages of recovery. In 2007, peer recovery support services were recognized as an evidence-based practice model, and it's now being offered at hundreds of RCOs around the country. With only 13 here in Maine, we need more. Last year, during a global pandemic, at 9 of the centers in Maine, there was nearly 7,000 meetings, groups, and activities offered with over 55,000 attendees. Recovery community centers in Maine made over 18,000 phone calls.
30 seconds, please.
Through telephone recovery support to over 700 individuals. And recovery coaches held over 2,400 sessions with more than 400 individuals. I've not only seen how RCOs transform our communities, but I've been transformed myself. PRCC has changed my life and the lives of many I love. As a person in long-term recovery from SUD, I walked through the doors of PRCC as a very different person than I am today. The staff welcomed me, offered me coffee and kindness, and made me feel a part of something for the first time in many years. As a person in early recovery then, I felt I had little to offer anyone, especially my community. The PRCC encouraged and supported me, helping me to understand that I'm so much more than my past. Today, I live a life I could have only dreamed of. Coming from a town in Maine with no recovery supports, I had to move to Portland to find recovery community. My hope is that recovery community centers can be available to everyone in Maine, no matter where they live. I ask that you invest in our people, our families, and our communities to provide hope and support to build recovery-ready communities around our state. And thank you for listening, and I hope that you vote ought to pass on LD 488.
Thank you, Ms. Proctor, for bringing that story. And now we can go to Mr. Fickett.
Thank you. Senator Claxton, Representative Meyer, members of the committee, thank you for having me. My name is Robert Fickett, and I reside in Brewer, Maine. I'm the executive director of the Bangor Area Recovery Network, or BARN, and a person in long-term recovery. Today, I'm here to testify in favor of LD 488, and I hope that my testimony will also offer myself as a living example of how an RCC can impact someone's life. I came to the Bangor area, a broken and suffering individual, awash in the hopelessness and demoralization of more than 20 years of opioid use. I was seeking escape from a shattered life of isolation and pain. What I found when I walked through the doors of the barn not only encouraged me to enter recovery and help to sustain that recovery, it transformed my life. Because when we talk about recovery, we are talking about transforming people's lives. I found others like me at the barn, people who offered love, compassion, understanding, and acceptance that I so desperately needed. I was able to access recovery supports, be connected to resources that helped me to better myself, gain employment, and start to live a healthy and productive life. I got involved and I was shown the value of giving back to my community. At the barn, I found health, home, purpose, and community. It's shaped the man that
30
I've become
seconds,
today.
please.
Thank you. Someone asked me recently how I became executive director of the Bangor Area Recovery Network, and I summarize it very simply. In my early days of recovery, I was coming here to just try to stay substance free for one more day, to be safe. When somebody approached me and said, "Bob, would you like to help?" And I haven't looked back. I thank you for hearing me today. And I would ask that you consider voting in support of LD 488. I'm happy to answer any questions you may have.
It's a great story. Mr. Fickett, thank you for being here. Next, we'll go to Mr. McKenzie.
Senator Claxton, Representative Meyer, and honorable members of the Health and Human Services Committee. My name is Bob McKenzie, and I'm here before you today in support of LD 488. So I'm a Kennebunk native and resident. I've been in law enforcement for over 33 years, so in the last 13 years as chief of police. I'm also on the board of directors for Milestone Recovery in Portland. I've seen the firsthand effects of substance use disorder by way of death and the pain that causes to everyone involved in my 30 plus years in law enforcement. I'm also very much in tune with the financial impact that the disease of substance use disorder has on all of us in our society. For the past decade, I've been very active in educating communities around the state on the issues surrounding substance use disorder with the goal of saving lives and reducing stigma. I've facilitated multiple naloxone trainings, recovery coach trainings in the Kennebunk area and beyond in an effort to assist those with substance use disorder find and stay in recovery. The state of Maine and Governor Janet Mills have taken great strides to save lives by combating this issue. This resolve would make a substantial impact in saving lives and will most definitely help guide those with substance use disorder to a successful and productive life. I speak from not only as a public servant who has dedicated oneself to help those with this terrible disease, but as a parent of 2 adult children who are in long-term recovery. I've seen firsthand what families go through watching their loved ones suffer. I've been that parent lying in bed at night wondering this would be the night that police officers come to my door telling me that substance use disorder stole my daughter or my stepson's life from our family. We're very fortunate that both of my daughter and stepson were able to find their path to recovery and are doing well. I'm certain that a large part of the recovery stemmed from connection because we didn't shun them. We embraced them during their time of need. We also had the resources available to help them, but many that are suffering from substance use don't have that support. The community recovery organizations brings connection, support, hope, and meaning to the lives of those that are in need. By supporting this resolve, you are paving the way forward for those in need of connection, support, hope, and meaning. It will not only save lives, but will reconnect families, will facilitate positive change in lives, and will save money in the long run from addressing the disease of substance use disorder. Thank you for your consideration, and I'll be happy to answer any questions.
Thank you, Officer McKenzie. I appreciate the testimony. Are there any questions? I don't see any. Again, thank you for your sharing that story. Now we can go to Mr. Gary. Oops, we're not hearing you. You're unmuted, but we're not hearing you. Nope, we're seeing you're unmuted and we're not hearing. We only run into troubles like this about 5 times a day. Yeah. One of the options would be to call in and our clerk can hook you up to a phone line. Yeah. Yep, sorry, we can't hear you. All right. If you can figure it out, we'll let you back in again. Okay. Mr. Page.
Good afternoon. Can you guys hear me?
We can.
Perfect. Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee. My name is Ryan Page, and I am a person in long-term recovery. I'm also a recovery coach with the Portland Recovery Community Center and an organizer with Maine Recovery Advocacy Project. I testified today in support of the bill LD 488 to provide community centers to underserved communities throughout Maine. I am originally from York County, Biddeford, and I currently reside in Kennebec County, Vassalboro, and neither of those areas have a recovery community center. I was fortunate enough to go to Portland to seek recovery and have that opportunity to be involved with the Portland Recovery Community Center. And that's where I really found myself, right? That's where the connection happened, and I was able to be a part of a lifestyle that I had never known before. There's so much more at the recovery center than just not using anymore for me, right? I learned how to connect to other people. I learned through the various different groups that are offered there how to be a better father. There's a Fathers in Recovery group that I attended there with people that have substance use disorder like me that are
30
parents.
seconds, please.
I also learned how to get back to my community there. I have a written testimony that I've already provided. You guys can reference that. The Recovery Community Center is a home for the family of people that are in recovery. And today I am proud to be a part of this family. I thank you all for your support and your time today. Thank you.
Thank you for that testimony. So do we want to try Mr. Gary again and see if it works better this time?
Can you hear me this time?
We can, yes.
Perfect. Hey, good afternoon, Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee. My name is Ryan Gary. I'm the chapter leader for Young People in Recovery, Augusta chapter. I am before you today in support of Senator Chloe Maxman's bill to open recovery community centers in Maine communities that do not currently have one. The county I live in is Kennebec County, in particular, the city of Augusta. I have long dreamed of a space to call our own, but it became even more clear to me just how desperate we actually are for this space during the pandemic. Recovery support meetings of all sorts are one of the most important activities that we engage in the recovery community. During the pandemic, many of our meeting spaces closed and our connections were closed with it. Recovery communities are resilient, so as we heard earlier, we responded by hosting outdoor meetings, online meetings, and house meetings with masks and social distancing, but it was not the same. Many of our community members have died over this past year due to accidental overdose, and others, some of our longest standing members, have started drinking and using again. I am positive that many of these instances could have been avoided if our traditional meeting spaces had been available. We are in desperate need of a place to call home. We desperately need our own space, run for and by people in recovery. YPR's primary objective is to create recovery-ready communities, and I feel like we've done
30
our part.
seconds, please.
And today I'm here begging you to please vote yes to pass this bill and help us to continue our efforts in supporting the recovery community. Thank you.
Thank you for your persistence. Glad you could get through finally. Are there any questions for Mr. Gary? I don't see any. So we can hear from Ms. Juster now.
Hello, Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee. My name is Sarah Juster, and I'm a resident of East Blue Hill, Maine. I'm here today to testify in favor of LD 488 and the expansion of recovery community organizations throughout Maine. I am currently earning my master's degree in social work through the University of Maine where I am also a member of the Professional Opioid Workforce Response Program. And through my social work lens, I've come to understand that individual well-being is inextricably linked to the social environment. Individuals with substance use disorder, which is one of the most stigmatized conditions in our society, are often at a loss for finding safe community spaces to supplement psychosocial or medical interventions. And yet such recovery community centers and peer-led recovery supports are considered evidence-based in that they have reliably demonstrated positive effects on recovery outcomes. Although the existence of 13 recovery community centers is a major achievement for Maine, 7 Maine counties, as you've heard, do not have this vital support. I know it is a tough year to ask for funding, and yet we cannot ignore the cost to our state of unaddressed substance use disorder in terms of emergency medical care, incarceration, work productivity, and child welfare. It is more important now than ever that we fund the evidence-based responses that work, such as recovery community organizations, to ensure that people in recovery have access to connection and healing in the wake of such a hard year. Thank you for your consideration, and I'm happy to answer any questions.
Thank you, Ms. Jester. I don't see any questions. Yes, we'll go next. We'll go to Ms. Tate.
Thank you so much. My name is Winifred Tate. I'm an anthropology professor at Colby College and director of the Maine Drug Policy Lab at Colby. I've submitted testimony. I'm not going to read it. Basically, I am here standing in support of this bill as an ally to people in recovery and in support of the work that we're doing with the Maine Recovery Advocacy Project, this critical role that they're playing in the community. But I just want to emphasize that this is a bill that is not only supported by the testimony of the lived experience that you've heard here, but also by decades of research, by social scientists, public health researchers, and others who have really highlighted the critical role of community supports, and to emphasize that the costs of these are both human and economic for the state of Maine when we fail to provide these supports for our communities. So again, I know this is a tough budget season, but there are many, many places where we see the expansion of failed policing and interdiction efforts. And I would urge you to put money where we know it will do good and benefit all of our communities, and really put teeth into what we keep saying, which is that this is a public health crisis that we can't arrest our way out of. And it's time to really support the communities that are asking for this support and so deserving of it. Thank you for your time. Happy to answer any questions.
Thank you for your testimony. Are there any questions, Ms. Tate? I don't see any. Before we go any further, I want to make sure there's nobody else who'd like to testify in favor who hasn't already had a chance. If you would like to testify, put your hand up and we'll get you in here. The other thing I feel obliged to say is at least to acknowledge the incredible strength and willingness to be public about the struggles, the folks who spoke to their stories, and what an amazing demonstration of strength and resilience, and what a contribution to decreasing stigma. So I felt obliged to say something to all those people who are willing to take time this afternoon to testify. All right, so traditionally we have to ask if there's anybody who wants to testify against. That seems sort of pointless. Is there anybody who wants to testify neither for nor against? So that would conclude the public hearing portion of our consideration of LD 488. Thank you all for being here. Before we move on to the next bill, I want to make sure we have a chance to ask of Anna anything in particular we would like for the next work session. I don't see anything. And so I'm going to mandate a 6-minute break since we've been sitting for a long time, and we'll reconvene at 2:40. So welcome back to the Committee on Health and Human Services. Our afternoon session is to consider 4 more bills. The next bill is LD 968. And I see that Representative Stupak is here to do just that.
Good
Welcome.
afternoon. Oh, thank you. Thank you. Good afternoon. Good afternoon, Senator Claxton, Representative Meyer, and honorable members of the Joint Standing Committee on Health and Human Services. I am Representative Laura Supika, and I represent District 126, which includes a portion of Bangor. I'm here today to present LD 968, a resolve to expand mental health crisis intervention, mobile response services. And so during my time as a Bangor City Councilor, and especially in conversations with Bangor law enforcement, I began to consider the need for 24/7 mobile crisis response. I learned about how often police officers have to respond to mental health crises because there are no other response teams available. This was a consistent problem for the full 3 years I spent on council, and it impacted multiple departments, not just the police department. What has brought me here today is a desire to take a meaningful step towards a solution. LD 968 is that step. It would require the Department of Health and Human Services to expand mental health crisis intervention mobile response services to provide 24 hours a day, 7 days a week to the entire state. The department is directed to do this using funded provided for a request for proposal for behavioral health crisis center services. We know that institutions are expensive and not always the best option for people experiencing crisis. Meeting people where they are is not only more cost effective, but also a better way to treat those in crisis. The disruptions to a person's life incurred by being placed in a facility can have a significant impact. You end up missing work, appointments, and other obligations. But also troubling is that finding beds near your home, near your family, near your support systems is not always possible for most in this state. The Substance Abuse and Mental Health Services Administration Behavioral Health Handbook clearly lays out a best practices blueprint, and that includes mobile crisis. We need to meet people where they are, regardless of day or time, and regardless of if they live in a city or a rural town. The more we can connect with people in the manner, the better quality of support we can provide. Our communities will end up relying less on emergency rooms, jails, and institutions, allowing us to free up space for those who are in need of acute care. I am asking that we invest in the entire state, not just our most populous areas. We needed this service expanded yesterday. I look at it as a foundation that we can then properly build upon. My city is spending $150,000 a year for a homeless outreach coordinator, but all this energy and resources that we are pouring into getting someone inside is for nothing if the supportive services are not there when they start to experience crisis. Crisis doesn't just happen Monday through Friday, 9 to 5. Crisis doesn't wait just because the phone line is busy. When left without proper care, these situations can become much, much worse. And then perhaps we are dealing with an acute problem, one that could have been avoided. In those instances, we end up spending more money to address the issue, or worse, we allow another person to fall through the cracks. I also think about the first responders, who we are pushing this type of work on. It takes them away from actual law enforcement. It's not good for the citizens who don't get the help that they are asking for. And it's not fair to the officer because we are continuing to place them in an impossible situations. We don't pay our firefighters by the fire, we pay for the downtime as well. And that is what we need to do here. We need to adequately fund mobile crisis so that they are able to respond. Thank you for your time, and I'm happy to answer any questions that you might have.
Thank you for that. Yes, Representative Madigan.
Thank you, Mr. Chair. Thank you, Representative Supika, for bringing this forward. I wonder if you know whether Bangor has spent more time and money and effort dealing with mobile crisis now as opposed to, say, 5, 10, 15 years ago? Do you guys have a sense of whether it's becoming more of a cost for your city?
I know that we just across the board in the services that we provide, like our costs are going up because we are the service center for so many who don't have services. I can get you numbers on that over the past 5 years if you would like. For the work session, I can speak with the city manager and get you like hard numbers on that.
Thank you.
Yeah.
That'd be good to have for the work session. Are there any other questions? So you could help me by understanding how you visualize this service working. Are we going to have mobile units available, scattered, hopefully to cover the state?
Yes, in-person mobile units. So you're in crisis, you reach out, and then a person is able to come to your home, to your place of work, or wherever it is that you are in need, and help you with how you need or connect you with the services that you're looking for. So ideally, it would be, instead of, being deferred to 911, having a police officer respond, mobile crisis would come to your door and be there for you to respond instead. Was that
And
clear on that for you?
Yeah. Do you have a sense of what portion of the state geographically or by county is currently covered with that kind of resource?
What I know is that we have, it looks to be about 100 mobile crisis responders for the entire state. So, while we have people who are doing this, the need, we're not funding the need. Like there is a need for more people to be doing this so that they're actually available when the call comes in, because right now they're not available when the call comes in, and then they're referred to 911, and then the police are the ones responding. In the city of Bangor, we have Sergeant Betters who will be coming and speaking, and he'll be able to speak better to the need. But even though we have people who are doing mobile crisis response, like it is not felt because it is not being funded to the need.
Okay, thank you. Thank you for that. Are there any other questions of Representative Supaka? I don't see any, so thank you for being here and introducing this bill. And I don't, yes.
No, thank you, and I'll get back on that question. Thank you.
Okay. Representative Warren has joined us.
Good afternoon, Senator. Good afternoon, Representative Meyer, and esteemed members of the Health and Human Services Committee. Thank you for having me today. My name is Representative Charlotte Warren, and I represent the city of Hollowell and the towns of Manchester and West Gardner in the House. I also serve as the House Chair of the Criminal Justice and Public Safety Committee. Again, thank you for the opportunity to testify in support of LD 968, a resolve to expand mental health crisis intervention mobile response services. Last session, this committee and many of you unanimously endorsed Senator Kathy Breen's resolve to establish the working group on mental health. And Senator Breen and I co-chaired that working group. And I'm beginning my testimony to you today with a highlight of the group's guiding principles for the mental health system in Maine. I've included them in my testimony, so I'm not going to read all of them to you, but I am just going to highlight a couple of them. Some of our group's guiding principles were to build a system that encourages early screening, diagnosis, and evidence-based treatment for Mainers at risk of mental health problems in the least restrictive environment, align resources with services at the earliest stages of intervention and reducing in the more acute, severe stages, create a first response mental health system that relies on therapeutic intervention and does not default to criminal justice intervention. And the reason that I'm here to testify on behalf of Representative Supaka's bill is because this bill does in fact align with these guiding principles. After spending months working together on the mental health working group with professionals in behavioral health, law enforcement, Maine judges, Maine prosecutors, and defense attorneys, as well as those living with severe and persistent mental illness, the Mental Health Working Group endorsed the idea that Maine's wisest investment would be to strengthen the already existing crisis response system, and already existing being the operative words here. We have a crisis system in Maine built to respond to behavioral health crises, but it is vastly underfunded. We should be appropriating funds to strengthen existing community-based crisis services and provide care to patients who do not need hospital level care and who certainly don't belong in a jail cell. You've all heard the high percentages of people struggling with mental illness who are incarcerated in Maine. For example, Cumberland County Sheriff Kevin Joyce has consistently stated in public that he is running the state's largest mental health facility, and he's referring to the Cumberland County Jail. We're relying on our correctional system to house mental health patients. It's not fair to patients. It's not fair to our jails and sheriffs, and it's certainly not fair to our taxpayers. It is the most expensive response. And I'm here to tell you that jail there is nothing therapeutic about a 6-foot by 8-foot jail cell. Jails are loud, steel on steel doors, slamming environments created to punish offenders. Locking someone up who is experiencing mental health crisis is not only cruel, it's traumatic and it's damaging. It costs us more, and it ensures that resources will be spent for a longer amount of time. But in Maine, we simply don't have the capacity in our mental health system to care for all of those who require help. As Representative Supaka previously stated, within our current system, law enforcement officers are the first responders. We have defaulted to that system. Our law enforcement officers trained to serve and protect are currently the ones that are called. And when police respond, there are only 2 options: take the person to the hospital or take them to the jail. And as I stated before, these options are the most expensive and the least effective. Instead, community-based crisis response services, including what already exists in Maine, existing hotlines, mobile crisis units, and crisis stabilization units throughout Maine, fill a critical gap in our mental health system and allow law enforcement officers to focus on their job, which is protecting public safety. I will tell you folks that since the murder of George Floyd this summer, states across our nation are scrambling to figure out a way to do police response differently. I happen to know a lot about this because this is what I do. And we are, in many cases, in such a spectacular position because we've already created a system that's the envy of other states. This idea that you have an alternate to law enforcement, that consists of hotlines, mobile crisis stabilization units, we're in a really good position. We just have to fund them properly. And so instead of adequately funding our existing crisis response system, the department is aiming to spend millions of dollars on what the Mental Health Working Group advised against. And I want to say that again. The proposal by the department to create the Cumberland County Crisis Center is what the Mental Health Working Group advised against. It's the shiny new thing. And as our research in the Mental Health Working Group demonstrated, we need comprehensive reform in our mental health systems. And maybe the proposed crisis center in Cumberland County could be a really valuable addition to our system in the future. Certainly, if we had enough money, if we had unlimited resources, we would do both of these things at the same time. But why would we do something new when we aren't adequately funding what already exists? And so the data should certainly direct us there. Let's fund what we already have. That's why I'm here today. I think I've given you enough information. My closing statement, let's help take the burden off our police, our jails, our taxpayers, and our Mainers struggling with mental health crises. Thank you for the opportunity to be here today. I'm happy to answer questions.
Thank you, Representative Warren. A question from Representative Madigan.
Thank you, Mr. Chair. Thank you, Representative Warren, for being here, and thank you for pointing out that we do have an existing system. And you brought up the funding issues. I'm wondering if you know, or whether you could bring to the work session, how funding has changed in the past decade or two, because the system we have actually came out of a response to a lack of mental health crisis services that led to a murder in my town. And so I'm very aware of, if we don't respond to these things, people's lives are at risk, not just people who may be victims of crime, but people who are living with untreated mental health problems. So I would love to know more about the funding issues for our current existing system.
Exactly. Thank you, Representative Madigan. If I may give you a couple of figures. The last time I looked, the crisis center in Cumberland County was going to cost us a little over $5 million. I can assure you that law enforcement agencies from probably north of, let's say, Brunswick, they're not going to drive to Cumberland County. They don't have time, right? To sustain the entire state's existing crisis center was last year's figures at about 4.4 million. So again, you know, I just really struggle with the idea of another thing being put in Cumberland County. I know that it's also a service center, but you know, when I think about your Chief Massey up in your city, who's working so hard with really, really tough, you know, tough circumstances, doing a great job, he's not going to drive people to Cumberland County. It's not possible. So thank you. I'll get those figures to you, Representative. I'm happy to do that.
Thank you. And thank you for pointing out that just transporting people to Cumberland County for those of us north of, say, Brunswick, winds up costing the taxpayers in my town more money.
Exactly. And for small departments, like all of our municipal law enforcement departments are kind of north of Portland, we can't, you know, we got one law enforcement officer on right at all times. We don't have multiple, we don't have large police. So this idea, it just, thank you.
Representative Griffin had a question.
Yes, thank you. I just have a question. Where are the 100 mobile response services now?
Yes, we have a map for you, and I believe that Representative Supica attached it to her testimony, quite possibly. If you don't have it, I will make sure that your clerk gets it immediately so that she can email it to all of you. But we do have a map so you can see where everything currently exists.
Okay, and is it okay if I ask another question?
Sure, sure.
Okay. And how does one call the service? Do you call by 911 or how does that work?
Thank you for that question, Representative. We are trying to make that change currently. Currently, the way our E911 system is set up in the state of Maine is they can dispatch 3 different entities. They are allowed to dispatch fire, rescue, and law enforcement. So you can see right there, there's one of the problems, right? So you will see a couple of bills coming toward your committee. But I have one specifically that aims to adequately fund our existing crisis system and also would start a system where there would be a fourth entity that E911 could also dispatch for a sort of, you might think of ride along, but in a separate car, right? To actually send along a social worker or somebody that's trained in crisis. Because a lot of times also what's happening with your municipal law enforcement officers is if they do end up taking someone to the emergency room, they're not allowed to leave them there. So they are staying with them in the emergency room the whole time. And that is something that a crisis worker could do if they were dispatched. So thank you for that question, Representative.
Thank you.
Representative Stover.
Thank you, Senator Claxton. And welcome, Representative Warren.
Thank you.
For the work session, I think it would be really helpful to look at the map that has been provided by Representative Speaker, but also to look at what is current and what is proposed, almost like if we could have some sort of mapping. And then, I mean, ideally to look at what was, because like Representative Madigan, I was around when we converted the state crisis system into the private crisis system. And we actually had ride-along programs, particularly in Waterville under contract and some other places, separate from the ICMs, to have crisis workers out there. It wasn't perfect and there's no panacea, but it was a lot more than we have right now. And I just wonder what is going to be the dollar amount to reinstate crisis systems so there's far more coverage. It is not a criticism of the system or the people who work in it because they're doing everything they can every minute of the day. They're short-staffed. We're a big state. It takes too long to get from point A to point B. So if it is a $5 million proposal, what that could possibly look like, in addition to the other array of crisis beds, and what options there are, because this isn't it isn't just a crisis system. There's more of a systemic issue, which is crisis often has no place for people to go either. And people are sitting in the emergency rooms for 1, 2, 3, 5, 6 weeks. There was a person at Midcoast for 6 weeks in the emergency department because there was no place to go. So if we're going to
Is there a question in here?
yes, to have, if we could have for the work session, more information about what the proposed would look like, not what it would look like, how many more there would be. Thank you.
Wonderful. Will do. Thank you.
Are there any other questions, Representative Warren? Well, thank you for being here.
Thanks for having me.
And then we'll hear from Ms. Gore.
Good afternoon. Thank you so much for having me. My name is Jean Gore. I'm speaking in support of LD 968. I am the parent of a young man who has been involuntarily hospitalized 43 times in this state. He suffers from schizoaffective disorder and anosognosia, which is a neurological condition affecting as many as 50% of those with schizophrenia or bipolar disorder. Anosognosia, sorry, it's a really hard word to pronounce, robs a person of the ability to know they are ill. I'm also the coordinator for the National Shattering Silence Coalition, whose mission is to speak out and inspire change for people affected with serious brain illnesses. In the interest of time, I'm only going to give you one example of a time when I desperately needed crisis intervention, but instead, when faced with the choice of saving my son's life or mine, I chose my son's. 3 years ago, my son suffered a psychotic break. He'd been living in an apartment in Berwick, but his behaviors had become so bizarre that his neighbors had begun complaining to his landlord, and I had to bring him to my house in Shapley. He was drinking heavily and was threatening to kill my husband. I called the crisis line, and instead of offering to come themselves to help us, they sent 2 officers from the sheriff's department. When they arrived, I asked them if they had crisis training. One did, the other did not. I told them my son was very sick, psychotic, agitated, and drunk. I asked them, if my son becomes agitated and threatens anyone, would you shoot him? One officer replied that he would absolutely shoot him. Upon hearing this, I told them they were not welcome at my house and asked them to please leave. It's only by the grace of God and our many years of experience dealing with my son's illness that we were able to ride the crisis out until his medications kicked in a month later. No parent should have to be put in the impossible situation of fearing for their child's life or their own when calling for help. The fact is, people with untreated serious mental illnesses are 16 times more likely to be killed during a police encounter. By dismantling the mental illness treatment system, we have turned mental health crisis from a medical issue into a police matter. This is patently unfair, illogical, and is proving harmful both to the individual in desperate need of care and the officer who's forced to respond. It should horrify but not surprise anyone here that people with untreated mental illness are overrepresented in deadly encounters with law enforcement. Individuals with untreated mental illness are vastly overrepresented in every corner of our criminal justice system. Until we reform the public policies that have abandoned them there, these tragic outcomes will continue. One step towards reform is indeed to expand mental health crisis intervention mobile response services. Thank you so much, and I really, truly hope that you do pass this bill. And I'd be happy to answer any questions you may have.
Thank you, Ms. Gore. I don't see any questions right now. So next we'll go to Kristen, and I won't try and mangle your last name.
Good afternoon. Thank you. It's Kristen Riccadoni. I am a vice president at Opportunity Alliance. And I would like to thank Senator Claxton, Representative Meyer, and all the members of the Health and Human Services Committee. I'm here today on behalf of our Behavioral Health Community Collaborative. So that's made up of 8 community-based organizations that serve adults and children with mental health and substance use needs. We're here to support 968. We believe the mental health crisis services system is a critical element of the mental health and substance use treatment system. We have had a comprehensive crisis system in Maine for more than 25 years. Since its inception, the crisis services system has responded to thousands of Mainers experiencing a mental health crisis, helped children, adults, and families get through the most challenging times in their lives. And I'm here today because the crisis system, whose purpose is to respond to Maine citizens during a crisis while keeping them safe and healthy, is desperately underfunded. Throughout the past year, as individuals and families have been impacted by the pandemic, the crisis system has been stretched. We continue to support during their crises, respond to individuals and families impacted by the opioid crisis, all while assisting people with the mental health impact of the COVID crisis. So as you know, the population here in Maine is 1.3 million. The state is about 320 miles long, 210 miles wide. So that's a total area of approximately 33,215 square miles. And as stated earlier, currently our large state has less than 100 full-time crisis workers that are available to respond to the 24/7 needs for all of the people in crisis across our state. So that's simply inadequate. With such few crisis workers available across these 33,000 plus square miles, we simply do not have the staff available to respond as timely as needed. And it was referenced earlier, but you do have an email that has a map that outlines the 8 districts that DHS identifies for service areas. And then there's also 2 slides attached to that, and it does detail for you the 7 agencies that currently provide the mobile response services and the crisis stabilization unit services. So it also breaks that down for you by the square miles, the population in each district, and the number of full-time workers for those services available. So you can see the current. So our crisis service system operates really similar to first responders, but we do not have the available staff to respond as timely as police officers do. We need more funding so that law enforcement will have help in getting immediate mental health and substance use services for the people they're asked to deal with, instead of arresting and putting them in jail. An infusion of resources is required to provide the services that are needed. Adequate funding and strengthening the crisis services system will help Maine taxpayers also avoid funding the much more expensive and ineffective solutions of sending people with mental health issues to jail or emergency departments. So again, we support 968 because the current crisis system service across the state does not have the resources to effectively meet all the needs for all the individuals. Additional funding is needed to ensure staff are available to support them in a crisis, while also supporting law enforcement officers and other professionals who desperately need a crisis response in a timely manner, 24/7. So the 7 community-based organizations that are already contracted with DHS, we have the experience, the knowledge, the expertise to operate the robust, efficient, and highly responsive crisis system that's needed. We just need more resources to hire more employees to respond across our state. So at this difficult time, we need to invest in it and strengthen the existing crisis system, rather than funding new programs such as the Cumberland County Crisis Center initiative the department has proposed. We are here because we want to take care of our clients. We want good outcomes. We want to successfully address the issues of making sure people get the right services at the right place at the right time. We're in this business for that purpose. So we urge you to support.
Thank you for your testimony.
Thank you. Sorry if I went over.
Representative Madigan.
Thank you, Mr. Chair. Thank you, Ms. Riccardoni. Did I get that right?
Yes, thank you.
My question is, we've heard a couple references to the 100 crisis workers dispersed throughout the state. I would like to know, has the total number of those employees deployed throughout the state, granted employed by private agencies, changed over the years? And this may be something you can bring to the work session or someone can get, and whether the funding's changed, and whether how easy or hard is it to hire folks to do this job? You know, I'm looking at getting kind of, is that part of the problem? Is the funding not allowing you to hire people so they want to work and do a difficult job?
Thank you for your question. We would very much like to be a part of the work session and could present exact data on how many positions are maybe vacant compared to years past, but this would fall under that umbrella of a workforce issue under mental health services, that it is challenging to keep the workforce there. And we're also saying we need additional support to fund existing programs, because some of those programs, as noted in an earlier session today, we're operating with deficits, even if fully staffed or close to it. So there's a few pieces to that problem. One is workforce, one is inadequate funding, and one is the funding structure to maintain these mobile services at just break even. We'd be happy to bring more specific data into the work group.
Thank you very much.
As well as, you're welcome, the proposal for what it would take for solution, because I heard that question as well.
Right. Representative Lemelin.
Thank you, Senator. I was wondering, I don't see Representative Supika's written testimony, and is it Ricky or Donnie?
Rick,
Yes.
Yeah,
Rick
I
Downey.
don't see her testimony either. Are we going to be provided with that, sir?
it depends upon if they submit them. We'll post them. Some of the information has apparently come by email, but we can post to the mailbox as it comes in. Were you going to send in your remarks, Ms. Riccadoni?
Yes, we will. And I believe we sent via email just prior to the session this afternoon, the 3 slides that I'm referencing. So I'm sorry that it's not readily available to you, but we'll be sure that it is. It was sent via email from Betsy Sweet, but it was just prior to the session. I believe the clerk has it.
Okay,
We will
Thank you.
submit it.
thank you. Are there any other questions? Thank you for being here. And
Thank you for
now
your time.
now we can go to Ms. Shaughnessy.
Good afternoon. Excuse me, Senator Claxton, Representative Myers, and members of the Joint Standing Committee on Health and Human Services. I am Mallory Shaughnessy here again, still a resident of Westbrook and Executive Director of the Alliance for Addiction and Mental Health Services. Please accept this testimony on behalf of the Alliance and in support of LD 968. As a member of the 2019 Working Group on Mental Health, you've been hearing a little bit about, and specifically as a member of the Crisis Services Subgroup, I can tell you the discussion with the task force quickly went to the gaps in our system of care for those struggling with mental illness and crisis. And as you've heard, it went to the unfortunate intersection of law enforcement and the mentally ill in our communities. One of the key recommendations that came out of the working group, and one of the biggest concerns brought by many members to the table, was a need to invest in and expand access to crisis services. You've been hearing a bit about this already. And we heard from the law enforcement community that they don't know what to do when they come across somebody in a mental health crisis at 3 a.m. We found out that ride-alongs, I think somebody else referenced that, ride-alongs with crisis workers have largely been lost due to budget cuts. Community outreach to check in on more vulnerable community members has ended. And the crisis stabilization units are too few and far between. And that mobile response is largely non-existent in many areas of the state. So the demand for crisis services has grown this past year as we've moved through this pandemic and the impacts of it. And as a result of all of this, many of our vulnerable Mainers with mental illness have ended up in our jails, in our emergency departments, and some of them ending up in our morgue. This cannot continue. I want to thank Representatives Supika and Warren for bringing this legislation forward. And I'm hoping that this committee will give it a unanimous ought to pass vote. I would also like to highlight for the committee that federally, there was passage last year of legislation to move mental health crisis to a new 988 response line. This is rolling out to the states. We'll be finding out more about it. It has some additional funding to assist in expanding crisis services. And there's also the American Rescue Plan, which puts a 5-year Medicaid enhanced match for the development of community-based mobile health and substance use disorders. So in some ways, I'd like to have you think of this as a first down payment that more could be done as this other funding comes in. And there's $15 million going out to the states for planning grants to assist with developing state plan amendments or waiver requests to do more innovative things with crisis. So just to know that that resource is coming. And I appreciate your time and effort on this, and I would be happy to come and bring any information or answer any questions.
Are there any questions from Ms. Shaughnessy? I don't see any. So now we can go to Sergeant Betters. Welcome, sir.
Yep. Hey, can you hear me?
We can.
2 minutes. All right. So just speaking real quick from the police perspective, I can tell you this is absolutely a need. We want relief from being the primary field responder to mental health crises. Last year alone, Bangor PD responded to several thousand welfare checks alone. We also transported about 650 people to the hospital after deciding in the end, after conversation, that they would need to be seen by an ER, an intake person. There were a little over 200 people in addition to that we were able to work in conjunction with our mental health liaisons to redirect those people from the ER. I can't say it enough. I know I don't speak for all law enforcement at the moment, but we are drowning in this type of work. We need completely funded response teams 24/7 that we can dispatch right when the call comes in to our dispatch centers. We need a 2-person team at a minimum to roll in a vehicle and be ready to come out and take over, or just go to the scene and they can call us if they need us. People that are trained in de-escalation and self-defense, so they can have a little bit of confidence going in to deal with people that are a little amped up and might be more difficult. I think there's a misconception that people think that the police want to be involved in that, and it could not be further from the truth. I can tell you that over the years and years of doing it, hindsight's always 20/20, and people like to cast judgment and make comments after the fact, but the officers are well trained. We have a ton of experience in dealing with people in a wide range of emotional situations, but we really need this to be a reality. We need to be able to farm some of those calls off onto a mobile crisis unit like they're doing in Denver, Colorado right now. Already their program has been very successful, and they have a crisis worker, a nurse, substance abuse counselor. They literally ride around in a vehicle and they go to that person's house, to that campsite, to that place in the woods, and they actually deliver service, which has taken the burden off from the police department.
Thank you. Are there any questions of the sergeant? Thank you for being here. I don't see any. I don't see anybody else who's here to testify in support. I do see that Dr. Pollard's here testifying against. Welcome.
Good afternoon.
Good afternoon.
So should I launch into my testimony? I wasn't sure if that was an invitation to start.
It is.
Okay. Well, so thank you for having me. And as mentioned, I'm the director of the Office of Behavioral Health with the Department of Health and Human Services, and I'm here to speak in opposition. And I'd like to offer the following information for consideration. So LD 968 seeks to require the department to expand mental health crisis intervention mobile response services to provide services 24/7 to the entire state, using funding provided for an RFP for a behavioral health crisis center service. So currently, mobile crisis resolution services are provided 24 hours a day, 7 days a week in all 16 counties of the state across 8 districts. Individuals experiencing a behavioral health crisis are triaged by the 24/7 statewide mobile crisis line and offered phone, text, SMS support. The majority of the calls are resolved without further intervention. Those that are deemed to be an imminent risk are triaged to emergency response, and those that are not imminent but cannot be resolved by the main crisis line are referred to the mobile team in the district where the crisis is taking place. Mobile crisis teams respond to the immediate needs in addition to assessing needs, develop plans which may include follow-up, and support the individual to determine steps to reach a resolution. Individuals in crisis are assessed in the least restrictive setting possible while receiving a client-centered and strength-based approach to assessment and intervention planning. We are proud of the work of our crisis providers. Over the past year, on average, 17% of calls to the main crisis line are referred to mobile crisis. In the most recent month of data, average response time of the main crisis line is 6 seconds. 83% of adults and 81% of children were seen by mobile crisis within 2 hours. 66% of adults and children were seen in less than an hour. Of those seen by mobile crisis since October 2019, on average, 2.5% were involuntarily hospitalized and 18% voluntarily psychiatrically hospitalized. In many ways, Maine's crisis system of care is in line with consensus and evidence-based national best practice guidelines issued by SAMHSA. We have a centralized crisis line with regional dispatch. We offer residential crisis stabilization, and we fund warm line supports. However, we're missing the key component of crisis centers, sometimes also referred to as receiving centers. As we can see from emergency department traffic, sometimes when people are in crisis, they need and want a place to go. Not everyone is comfortable having a crisis worker come to their home. Not everyone has a home for a crisis worker to come to. And when law enforcement are involved, they need a place to bring someone for care other than a jail or emergency department. Further, not all crises can be resolved by a mobile crisis visit, and not all of those require residential crisis care. The Crisis Center offers a comfortable living room model of support up to 23 hours that allows the person in crisis to get peer support, a longer period of time to de-escalate, initiate treatment, and develop a follow-up plan, potentially avoiding both inpatient and residential crisis levels of care. And it bridges the individual until they can connect with ongoing treatment post-crisis. In contrast to mobile crisis intervention, the Crisis Center offers psychiatry services and on-site pharmacy for urgent medication needs. There is ample evidence from other states regarding the effectiveness and cost-effectiveness of this model. We were thankful to see unanimous support by this committee for the budget initiative for our Behavioral Health Crisis Center that was included in the previous governor's budget and the most recent biennial budget. We are unclear as to the rationale for defunding the RFP for a crisis center in order to fund 24/7 statewide mobile services. In addition to being in line with national best practice, the Crisis Center approach and other changes implemented over the past year are consistent with the consensus recommendations related to crisis services available in the mental health system of the January 2020 Mental Health Working Group report. The Office of Behavioral Health expanded capacity of the intentional peer warm line as of May 2020. The Crisis Center is a clear way to make non-jail options available for crisis situations as alternative to jails, increase capacity of crisis stabilization, integrates crisis stabilization unit options with law enforcement, and the final point of crisis stabilization units should be expanded to be regional and available 24/7 with peer support available where acceptance cannot be refused is essentially the definition of a crisis center. In the current fiscal year, the Offices of Behavioral Health and Child Family Services also increased the portion and allowable uses of the cost settle component of the crisis provider contracts. We appreciate that the guiding principles of the Mental Health Working Group report included the Department of Health and Human Services is best positioned to influence change in the mental health system. It should take the lead on driving innovative and forward-thinking reforms through larger scale policy initiatives, as well as the recognition that the system should be evidence-based and emphasize the least restrictive environments. Implementing a crisis center demonstration is very much in line with both the guiding principles and crisis recommendation with the Mental Health Working Group. Finally, the committee is aware of the department's comprehensive rate system evaluation, which includes examination of the way crisis services are funded. We are thankful that the American Rescue Plan included an enhanced FMAP of 85% for mobile crisis. We anticipate with the rollout of the 988 behavioral health crisis number next year that the volume of calls to our main crisis line rather than to 911 will significantly increase. The Office of Behavioral Health recently successfully secured a 988 planning grant and is beginning phases of developing an implementation plan. The department is actively exploring the certified community behavioral health clinic model as one strategy for funding crisis services in line with the anticipated increased demand. Thank you for your time and attention. I'd be happy to answer any questions and make myself available for the work session.
Thank you, Director Pollard. Other questions for Dr. Pollard? Yes, Representative Madigan.
Thank you, Mr. Chair. Thank you for being here today, Dr. Pollard. I guess my question is, you're anticipating an increased need for crisis services with the introduction rollout of the 988 number. I mean, do you think what the department has funded now is adequate to take that increase?
So, there's a lot of ways to answer the question. I think we are working on the scaling up plan. By SAMHSA's estimate, the 988 rollout might increase the traffic to the crisis lines of states by about 30%. Right now, we have incredibly fast response times to those calls, and the majority are resolved without a referral to mobile crisis. I think that the fact that we have the relatively short response times is also promising. And what I'd like to see for solutions is the complete continuum to give people the array of choices appropriate to the crisis. So we are currently funding crisis services as a state just shy of $20 million between the main care mobile crisis. Well, that's not including crisis residential, but I should say the contracts by Office of Behavioral Health, Office of Child and Family Services, as well as the main care reimbursement for mobile crisis services. And then we have some other initiatives as well with co-response. You will see that we have an initiative in the budget for a justice and health team, which further adds co-responders in the form of intensive case managers, which we think is an acknowledgement that we do want to see some improvements to the system. And I think hopefully by the time the work session rolls around, we'll also be able to go into more detail about some of our other budget initiatives. So I think just the point is, it was a very long-winded way of saying we are working on the plans for how it would be best to scale up for that increase.
And just a follow-up kind of request. Thank you for saying you're going to bring all that to the work session. And I would like to see kind of just kind of what the funding has been for crisis services over time. Because I know at one time there was far more than 100 people, who were full-time staff members doing crisis across the state. And it does concern me that that I think that probably hits rural areas hard because they're always tougher to respond to. It takes longer to get out there. So if you could just bring that so we can see over time what the funding has been for crisis services.
Yeah, and I think it'd also be helpful really just to make sure we're looking at those response times. And I do think I wouldn't want anyone to think that the funding alone of the service will be the final solution or a comprehensive solution when we look at the challenges broadly about workforce that we have in the state. So you may have heard me say this in previous discussions, and I will probably be a little bit of a broken record about it because I just want us to be acknowledging the realities of what we have in terms of the state for an available workforce that isn't going to be quickly solved regardless of the amount of funding paid for the service directly. We need to have more more initiatives around development of the workforce kind of from the ground up in terms of training, bringing people into the state and maintaining them, because we don't have the available workforce pool of young workers in the state to even draw into the kind of frontline behavioral health positions.
All set, Representative Madigan?
Yep.
Okay, Representative Zager.
Thank you, Mr. Chair. Dr. Paula, thank you very much for your testimony. And I appreciate what you said about trying to make things as evidence-based as possible. I was wondering if the evidence for the crisis center, what sort of catchment areas were in those studies? You may not know that off the top of your head, but for the work session, it would be useful to know if we're applying the findings from the studies to a similar circumstance.
Yeah, it's a great question. I'm happy to go into more detail in the work session. I think it gives me an opportunity to say, our intention isn't that we would like to do this one crisis center for the whole state, but to think about this as a demonstration for what's worked in other states in both rural and urban areas, just to answer your question kind of with a simple answer, but we can certainly go into more detail. There are states that have these statewide in a mixture of different kind of geographical settings. And then there are some states where these are really focused solely in urban centers, but certainly it's been a mixture depending on the state, where these have been implemented and how close or not close of a comparison they are to the greater Portland region, Cumberland County.
Thank you. Appreciate it.
Are there any other questions? Thank you for being here, Director Pollard. We'll look for you at the work session, and we'll see if some of this information gets passed along or gets answered some requests.
Thank you.
Thank you. I don't see anybody else who wants to testify on this bill. Are there any questions we'd like to direct to Anna for the work session? I don't see any. So that would take us to LD 1262. And I don't see Kathy Breen. Do we know if she wants to present. Okay. All right. Well, I hate to dangle that in front of folks. Why, we could always go to LD 1147. That looks like there's only 2 or 3 people who want to present related to that. That would require the presence of Representative Madigan. Oh, there she is.
I'm already here.
I know. Thank you for being there.
Let me just get my testimony up. Thought I was going last. I mean, it's all right. I can do this on the fly. So, good afternoon, fellow folks on the Health and Human Services Committee. We keep hearing about the crisis in behavioral health services. We keep hearing rate bills. That is our job here, sometimes perhaps unfortunately, on this committee, but this bill is one of those. Medication management services are a vital part of our behavioral health care system. Psychiatric care from providers who specialize in this kind of care are necessary. You wouldn't get surgery from a primary care physician, and if you have a serious mental health diagnosis, you should see an appropriate specialist. For Maine residents, particularly those in rural areas, access to these services is limited, and it is expensive to offer these services. This bill aims to raise the rate for psychiatric medication management services so that providers do not continue to lose money. But at its heart, this bill is about access to these services. When rates do not cover the cost of providing services, agencies reduce the area covered, providers leave, and programs close. I am aware that the department is working on a rate study, but I don't think we can wait. Prior to the pandemic, our mental health system was frayed. This has only worsened. I believe it is our responsibility to act now to protect the availability of these services for some of Maine's most vulnerable citizens. People will be coming after me to describe the greater need, the need for this in greater detail, but I will be happy to answer any questions, and I look forward to working with you on it. And I just want to say that, I can often seem like a broken record about the need to adequately fund mental health services, but this is one of those just crucial services that are part of that system. And it's necessary. Having providers who are specialized in this that can work with medical providers around medications that have side effects is something you want a specialist to be able to do. In the years I've worked in this field, it used to be even if you needed a mere antidepressant, you would go to a psychiatrist. The fact of the matter is the psychiatry has changed so that many of those things people get from their primary care physicians, these days. The folks who provide medication management services are specialists. And if you have yourself a mental health problem, or if you have a child who has one, you want that specialist to see them. And I think that the lack of availability of that service due to how expensive it is, it's important for us to maintain. And and I think crucial for us to know that it's a national problem, getting enough psychiatry. So thank you, and I'll take any questions.
Any questions for Representative Madigan? I don't see any. So testifying in support would be Ms. Shaughnessy.
Let's see. Oh, trying to find it. All right. Can you hear me okay? Very good. All
Work
right.
again.
Once again, good afternoon again, Senator Claxton, Representative Myers, members of the Joint Standing Committee on Health and Human Services. I am still Mallory Shaughnessy, Executive Director of the Alliance for Addiction and Mental Health Services, and here to speak in support of LD 1147. In the past few years, there's been a crisis brewing in access to one of the very basic foundational community services for severe and persistent mental illness, which is medication management. Medications play a key role in treating several mental disorders and conditions and helping people thrive in the community. Treatment also includes psychotherapy of various types. But choosing the right treatment plan should be based on a person's needs and medical situation and under a mental health professional's care and guidance. Mental health medications require oversight, as I'm sure you've heard, to determine if they're addressing what needs to be addressed. Mental health professional tracks these changes, provides insight about the symptoms or side effects, helps make sure the prescription meets their need. This is all very critically important because some of these medications have potentially serious side effects. It's very important to follow the client's reaction to these medications until they know they're safe. We have been losing providers, however, of this service, and you'll hear from others about that. We have seen a lot of agencies stop doing this service because it is such a, they lose so much money doing this foundational service. Many providers feel that they need to maintain it because it is so critical for their patients, but it is something that is depleting their resources and they just cannot afford to do it. This would provide an immediate rate increase of 25%, which would about keep it, get it close to what the consumer price index has been since it was last really seen and looked at and reviewed. But it would also do a couple of other things. Once it has stabilized the service was the increase to keep the providers doing it, it also calls to pull a stakeholder group together for two critical things. One, to work together to develop a per member per month reimbursement rate or per member per week, but something that is a wrapped, bundled rate that covers all of the ancillary pieces that an agency needs to do to really provide the total wraparound and supportive care for somebody with their medication management. And it would also create a new kind of tiered level of services, similar to what we have in the opioid health homes, where we're putting the majority of the resources where they really are critically needed. So saying that somebody that has a more complex case, sorry, 30 seconds. So somebody that has a more complex case would have a higher rate that they could bill to so that they can make sure that they are seeing them as often and supporting them and doing the judiciary intervention when they have a PTP program or a papered or just more complexity. So there would be a higher level there. There'd be the standard level that would be that new rate. And then there could be a lower maintenance level that would be used when somebody is really much more on a consistent adherence to the regimen. So it would try to put the resources where they're most needed, similar to the opioid health home. So I would be happy to bring more information or answer any questions about this. The need is critical. Like many of them, as you've been hearing, our system has been deconstructed and frayed for many years. And we are seriously losing these providers of this basic service. And with that, I will end and answer any questions.
Thank you. Are there any questions for Ms. Shaughnessy? I don't see any. Thank you for being here.
Thank you.
That'll take us to Mr. McAdam. Welcome, sir.
Thank you for having me. Senator Claxton, Representative Meyer, I'm here to talk briefly in support of LD 1147. My name is Tom McAdam, and I'm the CEO at Kennebec Behavioral Health in Augusta, Waterville, and Skowhegan. And I'm a resident of Portland, and I get the pleasure of driving up here every day. Kennebec Behavioral Health is a legacy community mental health center. We've been in business for 61 years. The last year, we provided med management services for children and adults. We provided services for 6,000, just over 6,000 persons. We consider ourselves a community mental health center, and we provide services for people that not only have severe and persistent mental illness, because we have a disproportionate number of folks in Kennebec County in particular, as it pertains to consent decree, but also commercial insurance and anyone else that needs the service. As of last Monday, a week ago, our wait list, we had 394 people on our wait list for med management services. 45% of our referrals that we receive here at the clinics come from other parts of the healthcare system, come from emergency rooms, from primary care doctors, from pediatricians, and a number of referrals come directly from the Department of Health and Human Services. We take a number of people that are being directly discharged out of Riverview Hospital. We are one of the largest providers of med management here in the state. The cost to provide med management since 2008 has doubled. The cost of compensation for physicians and medical professionals has actually more than doubled in terms of what our costs are. So we have received some modest increases over the last about a year and a half ago, which did help a lot. The department was in support of those increases, but as Representative Madigan has indicated, it really has not gone far enough. Last year, we lost just over $500,000 in our med management program, but we believe it is so critical to the continuum of services that we provide here in our communities.
30 seconds, please.
For the whole system. So I'd be glad to come to the work session if you need more information, and be glad to answer any questions that you have.
Thank you for being here, Mr. McAdam.
Thank you.
Are there any questions? I don't see any. So I don't see anybody here to testify against, or neither for nor against. So that'll conclude this portion of our work on LD 1147. Are there any questions we'd like to direct to Anna in anticipation of the work session? I don't see any. So now we can go to LD 1262. And sorry to those of you for whom that was dangled and then taken away. And we're joined by Senator Breen to present this bill. The floor is yours.
Thank you very much, and good afternoon, everyone. Just 1 second, I need to find my testimony. Great. Thank you so much, Senator Claxton, Representative Meyer, and distinguished members of the Joint Standing Committee on Health and Human Services. My name is Kathy Breen. I represent Maine Senate District 25, which includes 6.5 communities in Cumberland County. And I'm here today to introduce LD 1262, a resolve directing the Department of Health and Human Services to develop a comprehensive statewide strategic plan to serve Maine people with behavioral health needs throughout their lifespan. As members of the legislative committee that oversees the Department of Health and Human Services, you know better than most of our colleagues how many bills are proposed to improve, update, fully fund, staff, and deliver effective behavioral health services to our fellow Mainers. I was here myself last week to discuss one of my bills on this topic. Whether it's children in foster care, children in Long Creek, adults with intellectual disabilities, adults with substance use disorder, seniors experiencing social isolation, or the Maine Care Reimbursement Rate Study, you hear about it all day, every day. I believe our efforts could be more effective if we were all working toward a common goal, and I hope you agree with me. If you do, LD 1262 will help us get there. As you may know, the Mills administration is a believer in stakeholder engagement and long-term policy planning. For example, the Department of Economic Development is guided by the 10-year economic plan. Further, when the COVID-19 pandemic hit the state, Governor Mills appointed the Economic Recovery Committee with the express purpose of bridging the crisis to the DECD's 10-year plan. That group put forward both short-term stabilization recommendations as well as longer-term priorities. The link to that report is here. In similar fashion, the Mills administration came out early in its commitment to addressing climate change by appointing the Climate Council and tasking that group with developing a plan. It's the Office of Policy Innovation and the Future that leads that effort. After considerable stakeholder engagement, the Climate Council released its report and recommendations on December 1st, 2020. In the 129th legislature, I sponsored a bill to create the Mental Health Working Group. Several months of meetings brought together some of the most knowledgeable experts in the state on mental health treatment, and I'm proud of the group's final report. But while we did a great job putting together recommendations for very specific things, particularly the needs in regards to the intersection between law enforcement and mental health services, we all recognize there's not a vision or a strategic plan that carries out the vision to address the key problems the system faces. Issues like underfunding, geographic disparities, and transportation. Also, the silo effect between corrections, emergency rooms, and community-based mental health and crisis systems have kept us from achieving more positive, lasting results, even within the resources we have currently allocated. The new director of the Office of Behavioral Health, Director Pollard, was hired midway through the working group's process in October of 2019. While she was a welcome addition, she was understandably just getting started in this new role. Her experience added considerably to our discussions and work, for sure, but the full impact of her office and team was limited at that time. We were just together a few weeks ago to hear an update on DHHS's main care reimbursement rate study. This is obviously an enormous undertaking and one that will have impacts on consumers of main care services and on our state budget for years to come. I have to say, learning that day that rates for behavioral health services will not be studied until 2023 was alarming. Like you, I hear from constituents regularly about the waiting list they or a family member is facing in order to access behavioral health services for which they are eligible. In addition, we all know that emergency departments are too often crowded with acutely ill Mainers who are waiting far too long, either for an inpatient treatment bed or outpatient services like case management, medication management, supported housing, and appropriate therapy services. My hope is that the Mills administration will focus on behavioral health with the same rigor and commitment as it has in other pressing policy arenas. We need a behavioral health system that we can staff and fund as appropriate. Consumers, community providers, taxpayers, our hospital systems, all of us need a vision and a strategic plan to build and maintain a robust behavioral health system from birth to the end of life. When bills come forward, this committee would then have a framework and some parameters by which to measure them. If I were in your seats, I would welcome the opportunity to compare Bill A, B, and C to a shared vision and strategic plan and decide whether that bill moves the plan forward. One of our neighboring states, New Hampshire, recently began to implement its statewide plan. That's attached. It's linked in the testimony, and I'm sure we could learn from their efforts. In the meantime, there's still much the legislature needs to do until this plan is up and running. We should keep trying to improve the system in the short term through main care reimbursement rates that genuinely cover the cost of services, targeted allocation of federal funds and other measures, while at the same time working with DHHS on a larger vision for the future. I hope you'll support LD 1262. I appreciate you listening, and I'd be happy to take any questions.
Thank you, Senator Breen. Are there questions of the senator? Yes, Representative Perry.
Thank you. I can't find your testimony, either that or I'm looking in the wrong place. I'm not sure. When you said a link, I'd really like to be able to follow up on that. Did you put your testimony?
I can see it. It's on yeah, it's underneath file in our files under 1262 and under the written section, not the speaking section. But it's there. Okay, any other questions? I don't see any. So we'll go to hear from some of the supporters, beginning with Betsy Sweet.
Hi, Senator Claxton, Representative Meyer, members of the committee. Thank you so much for your time. I do not want to take much of your time. I think Senator Breen has laid out the issue. You have heard between this year, certainly, and those of you who heard around the last 2 years, over 350 pieces of legislation aimed at improving the mental health system. We are, in so many ways, our community mental health system, the bones of which is the envy of many states, as you heard in the last bill, but has not been maintained and properly resourced. And so where we are now is we have the bones of this very important and system that was designed for recovery, that was designed for community integration, that was designed to keep people in place as they recovered, as they got services. And it has just the funding, the finances, and the vision keeping it alive has withered on the vine. And so now we are struggling every day. Providers are struggling every day, every minute to hold on. It is time for the new vision. It is time for us to be able to have benchmarks to say, what can we measure this against? What is the goal? What percentage of people do we believe can be in recovery? What percentage of people do we believe can be integrated successfully into their community with just minor supports? What is that going to take? And too often, the money bills that you see, and you're told what you need, and then it's all within a particular framework, which is not the framework of what will it take to fix this problem? What will it take to fix the problem to not send kids out of state? What will it take to fix the problem of ensuring that law enforcement can count on an emergency system and a mobile crisis system so they don't have to take people to jail or to the emergency room? What will it take for that all to work? The bones are there, as I said, but we're not asking the right question. And I think it's because we're missing that strategic vision. You know, one of the things that is very frustrating as we go along is all the new initiatives. And I'm all about new initiatives. It's awesome. Best practice is really important. But if we are not taking care of the foundation and we don't have a vision for what a solid foundation looks like, then we are building on top of something that's sand. And so I would urge you to pass this bill. Let's ask for a vision. Let's get the stakeholders involved. And again, not building from where we are and looking at the gaps, but what is the vision? What does a successful mental health, community mental health system look like? And then we can go from there. So I urge you to pass this bill. I urge us to get to work because, as Senator Breen said, we cannot wait.
Are there any questions for Ms. Sweet? I don't see any. Thank you for being here.
Thank you.
So we'll go to Eric Meyer. Welcome, sir. If you'll unmute, you can offer your testimony. There we go.
Thank you very much. Here I am. Thank you so much, Senator. Hi, everybody. Senator Claxton, Representative Meyer, members of the Joint Standing Committee, Health and Human Services. My name is Eric Meyer, President and CEO of SpurWink Services. At SpurWink, we provide behavioral health and educational services to children, adults, and families across the state of Maine. And I'm here to speak as president, also here to speak as president of the board on behalf of the other members of the Alliance for Addiction and Mental Health Services. And I am here to urge you to support LD 1262. And as a member of the Behavioral Health Community Collaborative, I can also assure you that they are supportive as well. We have a unanimity across the provider community, certainly in favor of this bill. So this bill calls on the Department of Health and Human Services to develop a vision and comprehensive statewide strategic plan to serve people in the state with behavioral health needs throughout their lifespan. And it goes further to state that for the purposes of the resolve, behavioral health includes a wide range of mental disorders and illnesses, substance use disorder, developmental disabilities, including autism spectrum disorder. So SpurWink provides comprehensive services in all of these areas. And from our experience, we see that there is far too much siloing of services, far too much siloing of policy, and the impact on clients ultimately and people receiving services is significant. The transitions between levels of care, between services as folks age, as their needs change in the community are often disconnected, often disruptive, and very counterproductive to the needs of individuals in service as well as the community. Over this past decade, we've seen many gaps develop in the system, in addition to the siloed ones that existed there, as others have already said. And I and other members of the Alliance and the Collaborative have been before this committee in recent years and already in this session, and will continue to be so, to bring the gaps to your attention and to speak to them. I believe that this bill, LD 1262, in addition to helping to address those gaps, will bring the kind of vision and planning that improvements in our system desperately need, and to provide a roadmap going forward. I mean, what an important aspect of our system. And we see that, as mentioned about New Hampshire or other states, that in fact, this approach is one that many states and their people
30
benefit
seconds,
from.
please.
So thanks so much for this time. I really appreciate being able to speak to this, and please support LD 1262.
Any questions for Mr. Meyer? Can you give us some examples of that siloing, or when it doesn't look like there's an overarching plan? Because I'm pretty sure we're going to hear that there is, in fact, such a plan. So some from the ground up examples might be helpful.
So one that comes up a lot is the transition from children's services into adult services, whether it be adults with serious and persistent mental illness or adults with intellectual disability and autism. This has been a perennial challenge in our state. My entire career, this has been an issue, and it continues to this day. In other words, individuals receiving service as children and youth moving into the adult system find gaps in service, find an abrupt drop-off without services available to them, confusing changes in regulations and rules from one system to the next that also contribute to the loss of service. So that's just one small example.
Okay.
All right. You've heard that before, I think.
Yes.
Yes.
This is not new. This is not new. Thank you for that. All right. I don't see any other questions. So thank you for being here. Thank you for being so patient. It being later in the afternoon than you thought it might happen, but
no problem. Thanks
you
so
know
much
about
for the time.
legislative time. And we're joined by Ms. Shermer. Welcome.
Thank you. Thank you, Senator Claxton, Representative Meyer, and honorable members of the Health and Human Services Committee. I'm Julie Shermer. I am one of Kathy Breen's residents in Falmouth, Maine, and I'm here representing NASW as Vice President of their Board of Directors and co-chair of their Policy Committee. And I am in support of Senator Breen's LD 1262. I have a 30-year career in behavioral medicine and in primary care, knowing several of you on the committee. Prior to that, I was a healthcare planner down in outside of Washington, D.C. And I thought that was a hoax. I had a huge imposter syndrome because I really only was looking at numbers and not clinically what was happening. And what I'm seeing now with the COVID pandemic and what we've seen over the past 10 years, or actually 2 decades, with the increase in suicide, anxiety, and depression disorders, stress-related disorders, has created kind of a tipping point of we have this bare bones support, bare bones structure that was better in years past, but has slowly peeled away from the past administration, and we need to buffer that up. And recently, behavioral health providers and organizations have been shutting off services, closing doors. There are long waiting lists, as we have heard. And so I think we're in a crisis, and we need a good plan and vision for folks with behavioral health disorders. So we have to do better than what's done before. There have been other studies and other strategic plans. The last strategic plan from CDC on health gave 4 pages out of, I think, 38 to mental health and substance use disorders. There have been other comprehensive plans, but they've been specific to, say, substance use or specific populations. So I urge you all to help us and help all the folks in Maine who are struggling with behavioral health disorders to pass this important act. So thank you.
Thank you for being here and sharing your experience. Are there any questions for Ms. Shermer? I don't see any.
All right, thank you.
Thank you for being here. So now we can go to Ms. Barton. Welcome.
Thank you, Senator Claxton, Representative Meyer, and members of the committee. I'm Kelly Barton. I'm the president of Maine Behavioral Health Care, and I'm here to testify in strong support of this legislation for 3 reasons. Our behavioral health system is fragmented, under-resourced, and failing people in need. The behavioral health needs of our population are growing, and government investments in the system will be most effective if they are informed with the input and buy-in of providers, consumers, and families. Medicaid is the largest payer of behavioral health care, mental health, and substance use disorder in the United States, and it's our largest payer in Maine. In addition, studies show that behavioral health conditions contribute to greater costs to treat than any other medical conditions. As Maine grapples with increased demand for behavioral health services due to the COVID-19 pandemic, and as Maine receives federal support together to develop a statewide strategic plan for behavioral health that is based upon a thorough assessment of our current strengths, opportunities, weaknesses, and threats. The current system was broken prior to the pandemic, and COVID-19 has only intensified its crumbling. We all know that building a robust system of behavioral health services is complex. Complexity requires innovation and thinking beyond how we have ever done things. No one entity or individual can do it alone, and we definitely can't do it in silos. We may all have different roles in the behavioral health system, but in essence, we are all one team. And through the wisdom of Phil Jackson, the strength of the team is each individual member, the strength of each member is the team. Without a strategic vision that engages all of the stakeholders, we will continue to have a fragmented, far from adequate system that fails to meet the needs of Maine residents. Many states are in similar positions and are taking proactive approach to engaging key stakeholders from all pieces of the continuum of care. Any pathway to address the mission and vision should include the full picture outcome we want for today and tomorrow, the barriers at a regional, state, and national level, the input of key stakeholders, and a holistic focus. The focus should include patient-centered. That includes a full continuum of care with minimal administrative burden. Innovation, it must be data-driven, evidence-based, culturally competent, inclusive of shared populations with expedient access to care, and must be trauma-informed. We recognize that it has been years since investment was made in behavioral health services, including planning, and this department has had unprecedented crises to contend with at the same time. But we have reached a crisis point and we can no longer wait for future action. The state is receiving millions in pandemic resources to support behavioral health
30
care.
seconds, please.
Now is the time to engage. We cannot lose sight of significant gaps in the continuum. For example, Spring Harbor Hospital continues to see an increase in demand for inpatient services with an overall growth rate of close to 10%. In 2020, we had an average of 25 patients a day in our EDs for awaiting psychiatric placement. Adolescents are in need of secure units. Despite a 17% increase in outpatient psychiatry capacity since 2015, wait times are over 6 months or more. In 2019, we had an average waiting list for outpatient psychiatry for 425 patients at any given time, just at Maine Behavioral Health Care. An infrastructure developed can be of service to all. In closing, we have used the same approach for years to build a robust behavioral health continuum of care in the state of Maine, and the results, the system is crumbling, access is limited, key services are missing, and we continue to work in silos. In the wise words of Henry Ford, if you always do what you have always done, you'll always get what you've got. So I would advocate now is the time to come together and finally develop a system of behavioral health services that the state of Maine can be proud of. And I'd be happy to take any questions.
Any questions for Ms. Barton? Did you submit your testimony electronically?
I believe so. If I didn't, I can work on that.
I'm not seeing it, but we have a lot of people who wanted to contribute, so I may have missed it. But if you could, you had some statistics in there that are important. Thank you.
Yeah.
Any other questions? Okay, now we can hear from Kevin Voivodich.
Good afternoon.
Good afternoon.
So Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee, my name is Kevin Voivodich. I'm an attorney at Disability Rights Maine, and as most of you know, also one of the plaintiffs' class counsel on the AMHI consent decree. And I'm here today to testify in support of this bill. So I'd like to submit to you a few comments regarding this bill, regarding why we're supportive of it, and we think it's a really good thing. So first off, I did participate in the mental health working group, and I think Senator Breen set it off well, so as Mr. Meyer, talking about silos. I think we talked a lot about silos in those groups, and I'm going to expand a little bit on that with an example of the silos as far as the rights and regulatory perspective, because it does come up in our world. But I think that is an important point and why a strategic plan is needed. I just want to offer the following comment that as far as the agreement that we talked about earlier in the session related to the consent decree, any such strategic plan needs to take into account the current agreement as ordered by the courtmaster in January of this year, and regarding timely access to services and those standards. I think it can mesh with this, absolutely. I think it's just want to point that out. Third, I'd like to say that in section 2 of the bill, we just offer the comment that it does not seem advocacy groups such as Disability Rights Maine are included as far as stakeholder input to DHHS. And we believe, as the state's protection advocacy organization for individuals with mental health conditions and cross disability, including IDDD, and kids services, that we should be part of any stakeholder input related to that. Next, as far as children's services, you've heard bills on children's services. I think the real takeaway with children's services, we can do better. We need to keep kids in their communities, not send them out of state. There's a PCG report that has been referenced in a number of hearings over the years now, I think, related to kids services and the needs of those services. So I think it's just important to reference that, these silos, kids become adults and access adult behavioral health services. And that transition phase that Mr. Meyer spoke about is a phase where things can get dropped and there can be difficulty linking them up with those adult services. So we can do better for kids in the realm of behavioral health. Finally, in IDDD services, I think the takeaway here is that these are
30 seconds, please.
Thank you. Don't have conditions in silos. You could have an autism spectrum disorder and behavioral health needs related to a mental, health condition. And oftentimes we've struggled at Disability Rights Maine with, say, somebody in a psychiatric hospital needing to discharge that needs both. So there's that example. And the real struggle of you're either in one system or the other. And so we really think this cross-system planning, taking into account all the different state agencies, needing to kind of look at that big picture is really important for Mainers that need to access behavioral health services. So I thank you for your time and be happy to answer any questions.
Thank you for that perspective. Are there any questions? I don't see any. So again, thank you for being here. That'll take us to Ms. Shaughnessy.
Hello again. You guys have had a very long day. Hope you are taking time to get water and walk and move occasionally. So I'm Mallory Shaughnessy. Thank you for hearing my testimony. Senator Claxton, Representative Myers, member of the Committee on Health and Human Services. This is in support of LD 1262 on behalf of the Alliance. The concept of a multi-year strategic plan, as you've heard, was discussed at the 2019 Mental Health Working Group. It was clear that Maine needed a plan forward, a roadmap to break down those silos that we've been talking about, a way to connect the transitional ages and overlapping programs for those in need of behavioral health services. Another one of our neighbors, I think New Hampshire may have been mentioned, but Vermont also did this in 2019 and released the report in 2020. And I have the link in my testimony to their Vision 2030 10-year plan for an integrated and holistic system of care. It's got some really good things in it. Given the complexity of mental health challenges today, we recognize that no single approach or group will solve this. We need a collective answer, a collective vision for this future. And we need to come together to strategically articulate what is that short term, that midterm, and those long-term strategies and actions that are necessary to rebuild our behavioral health system and move it forward. However, please do not think that this legislation will absolve you all in the legislature from passing some needed critical emergency bills this session and fund them. The system is in disarray, and you heard from numerous people, the gaps are growing and the need is rising. I would say, you've seen me before you so many times talking about these issues, and they are real. Patches have been made, but the system remains with major problems. So below is a somewhat incomplete listing of all the bills of the past few sessions that we have brought forward to shore up the mental health safety net. There are over 300 bills brought forward. Many have been heard, many have been passed, and many have not been funded. Believe me, if we did not need these rate increases or these policy changes, we would leave you alone. But the need is real. The system is in crisis. So please, support this strategic plan and look to funding some critical behavioral health bills before you this session to get us to the end of the strategic planning. And then you can look through all the myriad of pages and pages of bills that you all have spent much time on. And with that, I will end and be happy to answer any questions or bring you any information that you may need. I would recommend you take a look at Vermont's plan. It's pretty comprehensive.
Are there any questions for Ms. Shaughnessy? Just a quick look at that. That list is a little bit of a downer.
You're gonna get some PTSD just remembering all those committee hearings.
Lordy, lordy, lordy. Okay.
We've got to do something. That's the bottom line. Thank you.
Okay, thank you for being here. And now we're going to hear from Sheriff Morton. Welcome, sir.
Good afternoon, Senator.
Good afternoon.
Again. Representative Meyer and honorable members of the Joint Standing Committee on Health and Human Services. My name is Troy Morton. I'm the Sheriff of Penobscot County and President of the Maine Sheriff's Association. Maine Sheriffs met to discuss this bill, and our unanimous position is to support LD 1262. LD 1262 may be one of the most instrumental of this session. While it directs the HHS to create a strategic plan only, the outcome of this direction could provide a pathway for all agencies that work with this vulnerable population. Maine sheriffs oversee the operations of 14 county jails and 1 regional jail. We are arguably one of the most impacted entities that see firsthand the needs of people, Maine's people with behavioral health needs. Maine jails were never designed nor intended to be the landing place for these citizens. Each and every sheriff has expressed inconceivable stories about the shortfalls of those that find themselves in our facilities simply because there was no place else for them to go. Behavioral health issues can and should be addressed within the walls of agencies directed to their well-being and recovery. Maine sheriffs would be happy to work with the HHS to find the best solutions for Maine's people with behavioral health issues, as we look to address and identify areas concerned outlined in this bill. Please consider voting ought to pass to start the process of addressing the desired needs of those who need it the most. I thank you for your time, and I invite any questions that the committee may have.
Thank you, Sheriff, for being here, and thank you for your testimony. Are there any questions? I don't see any, so you can have the rest of the afternoon off.
Thank you, Senator.
We'll go to Ms. Malign. Welcome.
Thank you, Senator Claxton, Representative Meyer, and esteemed members of the Health and Human Services Committee. My name is Simone Mallon. I'm the Executive Director of the Consumer Counsel System of Maine, which is a voice for mental health consumers to have access to advising state government and the legislature on mental health policies from the lived experience perspective. We also were members of the mental health working group, which Senator Breen and Representative Warren chaired marvelously, I will add. And we could not push more support to this bill than anything else. As Sheriff Morton said it very well, pivotal, because we're spending a lot of money in Maine. Are we spending it in the right places? Don't really know. because I've been around for a long time and in previous iterations as a social work provider and peer support provider, I remember times when in the 90s and in the 2000s where the department led major policy initiatives. There were plans, the community came together and we worked to solve issues together. We haven't done that for a very long time. And I think our system is showing the wear of not having a great vision and plan for us to even know if what we're doing is working and if where we're investing is where we should be investing. We have lots of patches and fixes. Mallory and Betsy listed all those bills, and there's been so many others. We really need to come together and work as a team. And I say a team because it is going to take all of us to create the vision. And the working group has really put some of that together and build on that work. Great organizations require vision and planning. And we as a state, to the consumers, my fellow consumers across the state, they deserve to have a great plan and work that flows from that plan. And with that, I will stop. Thank you for your time.
Thank you. Yeah, Representative Madigan has a question.
Thank you, Mr. Chair. Thank you for being here, Simone. Thank you for bringing up that this is something we've done in the past. I've been around a long time too, so I remember that. It was before I was in graduate school, but I was involved in it because there was tremendous consumer involvement. So I wonder if you could speak to just how widespread the involvement of consumers and frontline workers were involved in that plan before.
Certainly, one example is we used to have community service networks that were across the state and they were regional. And there was representation from every peer organization, consumers at large. The council had seats at every CSN, was the acronym then. And even so, we met regionally with the department and worked through issues. Now, granted, that was the Office of Adult Mental Health. I do see a much greater need to be more broad. Prior to that, I think of times when we had the department sponsor listening sessions between providers and consumers for several days and over periods of time to greater understand each other and the needs and begin to work more closely together. So there's been lots of initiatives, but they have been non-existent for some time.
Thank you.
You're welcome.
Okay. I think, as I understand it, that concludes the testimony for those in support of this bill. And now we'll hear from a couple people who are opposed, starting with Ms. Gore.
Good afternoon again. Thank you for hearing me. I submitted testimony in support of this bill yesterday, but after reading it more carefully, I came to the conclusion that I cannot support it as written. Please don't misunderstand me. I think that we are seriously in need of a strategic plan. I am, as I told you earlier, the mother of a young man who suffers from schizoaffective disorder and anosognosia, and the coordinator for the National Shattering Silence Coalition. I'm speaking on behalf of parents in Maine whose children have become criminalized, homeless, are living in squalor, are dead, or have killed family members, all because we cannot get treatment for their illnesses. You must understand that anosognosia affects at least half of those with schizophrenia and bipolar disorder. It's the #1 reason people refuse treatment. Please let that sink in. In 2005, my son and I became entangled in this completely broken system. He became a revolving door in and out of your hospitals 43 times, was jailed twice, beaten up by 7 police officers in Burlington, Vermont, homeless, missing, and on, before we could get him into the progressive treatment program in 2013. What we need immediately is a complete overhaul of the system of care, prioritizing our most seriously ill. Your plan ignores this population. Under section 2, plan participation, you make no mention of how to represent your most ill population, those who suffer from schizophrenia and bipolar disorder and anosognosia. Family members are acutely aware of all that is right and wrong with our system of care. We have the information you need to create a system that will truly serve this population. They are too ill to speak for themselves. It's imperative that you allow a family member to represent them. Under elements of the plan, number 1 is protection of consumer choice. These patients are looking for medical treatment, or should I say their family members are looking for
30
medical
seconds,
treatment,
please.
not consumers. As for choice, do you ask someone suffering from dementia for their choice of options for treatment? It's fine to say those with capacity to make their own decisions must be given choices, but people who are in the throes of psychosis are unable to do that. Ask any psychiatrist in the room and they will confirm this. There have been several work groups appointed since 2010 to address this problem. None, to my knowledge, have resulted in a change to this situation. We needed help decades ago, and we're still waiting. Please, instead of spending more money on yet another study, recognize the entire system needs to be overhauled by all stakeholders, including family members of those who are too ill to advocate for themselves. Pass the many pieces of legislation that will help us, including LD 582, the ACT team reimbursement rate building, LD 785, LD 1090. Thank you so much.
Thank you, Ms. Gore. Are there any questions, Ms. Gore? I don't see any. Thank you for being back. Next, we can go to the Honorable John Nutting.
Can you hear me?
We can.
Great. Senator Claxton, Representative Meyer, other distinguished members of the Health and Human Services Committee. My name is John Nutting. After much thought and consideration, I decided to testify against LD 1262 and its passage at this time. There is an immediate crisis in our Maine's mental health system. Anosognosia, which you just had heard mentioned, lack of awareness of their illness, lack of informed consent. It really only affects 4 to 5% of the total number of people with mental ill. But according to Treatment Advocacy Center research, a majority of those in our jails and our hospitals suffer from this lack of awareness of their illness, and they tend to keep stopping the treatment plan and getting into trouble. This group is the one, in my opinion, that needs immediate focus now. As the author of the Progressive Treatment Plan that passed in 2005 and the Assisted Outpatient Treatment Plan that passed in 2010, I'm so gratified that it's helped as many people as it has. I couldn't have done it without my lead co-sponsor, Senator Peter Mills, and his wife, Judge Nancy Mills' support. Both bills received a 2/3 support in both bodies, but both laws are being drastically underutilized today. In this most recent study a couple of years ago, unfortunately, when Dr. Skinner, president of the Maine Association of Psychiatric Physicians, and myself, as a sponsor of those two bills and many other parents, attempted to bring up to the working group a strengthening of these two laws on the books. Any discussion of doing so was summarily dismissed, and it wasn't even discussed. This was very alarming to so many parents. In the wording of LD 1262, as Jeannie Gore just promoted to you, mention of working with parents of anosognosia folks is not even included. In the specific charge in section 2, working with a progressive treatment plan or the assisted outpatient treatment plan statutes that are on the book is not even included in the charge. Again, very, very concerning. I'm on the Riverview Hospital Human Rights Committee. We're in once a month. The hospital is running much better than it was before. But so many of our people there are there their 10th, 20th, 30th, 40th time over and over again because they're continuing to stop their treatment plan because they don't think they're ill. And yet this law is not being managed, and it will be a subject of another bill that will be before your committee a little bit later on. So if this study in any way is going to stop current bills before you from being passed, there are hundreds of parents and thousands of family members in Maine that would like to politely say, no, thank you to this bill. Please put the priority, at least this session, maybe talk about the study next session, because we have such immediate needs in that population that is the majority of those with mental illness in our jails and our hospitals. And with that, I'd be happy to try to answer any questions.
Thank you, sir. Are there any questions? I don't see any. Thank you for being here. Thank you for offering your testimony. So I don't see any other folks interested in testifying on LD 1262. Are there any questions we'd like to ask of Anna in anticipation of the public hearing? I don't hear or see any. So now we can go to LD 592.
All right, Mr. Chair.
Yes.
I'm sorry, I was slow on the hand raising. I just wanted to request that the link to the New Hampshire report, the hot link didn't seem to work on the PDF that we got from Senator Breen, and I think that would be a useful document for us to review in the work session.
Okay. Before a work session. Okay, thank you. Any other requests? Now that I'm looking. All right. Thank you. All right. So we will move now to hearing LD 592. Representative Gramlich is here to present that. Welcome.
The technology. Well, here I'm spending almost more time in your committee than I am the two of my other ones. But thank you. I know you all have had a long day. I'll try to be succinct, and a lot of this will be redundant. But let me formally start out. Senator Claxton, Representative Meyer, and my distinguished colleagues on the Joint Standing Committee on Health and Human Services. I am Lori Gramlich, and I represent House District 13, which is the lovely seaside community of Old Orchard Beach. I'm honored today to present LD 592, an act to ensure access to outpatient mental health services by increasing reimbursement for outpatient therapists. As you all know, you've heard numerous bills before you around the same topic, and that we in Maine are continuing to face a crisis in providing for children and adults with challenging behavioral health needs. Healthcare needs, pardon me. LD 592 would require that the Department of Health and Human Services increase reimbursement rates for behavioral health services, specifically for outpatient therapy for families in need of individual and group therapy, and that's under Section 65 of the Maine Care Manual. Outpatient therapists provide services and resources which often can prevent situations from rising to levels which often require greater degrees of interventions and services. In short, these are at times prevention-based services can ultimately save the state money. We've heard about the high cost of providing services to kids in need of residential treatment, for example. Imagine if we were able to provide services to children and families whose need for inpatient treatment even occurs. Several studies across various disciplines outline that preventing mental, emotional, and behavioral disorders is one of the soundest investments a society can make. The benefits include higher productivity, lower treatment costs, less suffering and premature mortality, and more cohesive families, and of course, happier, better adjusted, more successful citizens in our society. As I have identified before you all in previous testimony, we in Maine have been working hard to address both children's and adults' behavioral health since the mid-1990s. We have failed to adequately address the fact that we simply do not reimburse providers with an adequate rate to deliver the much needed behavioral health services. And as a result, both agencies which provide outpatient therapy as well as individual therapists who are operating to provide care for folks, are doing so at a loss. We have seen long waiting lists due in part to the fact that therapists simply cannot sustain their practice based on these current rates. As I've mentioned before you in previous testimony on related bills, we have seen increases over the past 15 to 20 years, anywhere from 50% to 200% in nearly every other sector. We've seen increases in healthcare insurance costs. We've seen increases in rents and utilities, increases in technology. The cost of doing business continues to increase, yet we have not prioritized increasing rates for providers who deliver outpatient mental health services. In 2015, the previous administration proposed a 10% cut to main care rates paid for key children's behavioral health services under the main care sections of both 28 and Section 65. And while the legislature at the time did not agree to these cuts, they also did not propose or improve any increases, but rather contracted with an outside firm to examine reimbursement rates for behavioral health care services. And I'm sure you'll hear from folks coming behind me that we need to do another study. I don't believe that we need another study when we already know what the solution is. And that 2015 example, that was 6 years ago. Our community mental health system, as you've heard all day long and probably since the beginning of your session, is indeed in crisis. And COVID most certainly has exacerbated the need for mental health services. The needs for our entire behavioral health care system continue, and the workforce shortage, which this is finding largely aimed at helping with the crisis levels. Organizations have hundreds of unfilled jobs because they cannot pay people enough to want to be hired or continue to work in their chosen profession. Makes it an access to service issue. We must act now. I urge you to pass LD 592. Let's get this done. Let's get this bill to the Appropriations Committee so that we can really start making some changes for those who are most in need. Thank you for your consideration, and I would be happy to try to answer any questions for you.
Are there any questions to go to Representative Gramlich? Thank you for being here and bringing this bill forward. So we can then go to Ms. Sweet. Welcome back. Whoops, you're still muted. You're still muted.
Sorry. Thank you so much. And thank you for attention. And I'm glad to be with you again. My name is Betsy Sweet. And I learned something today, which is I try and signed up last so that I would come at the end of all the people, but it turns out that puts me at the front. So I will change it up for next time. So
it's done alphabetically by first name.
Oh, is that right? Oh, okay. Well, nothing I can do about that then. All right. Well, I am Betsy Sweet, and I'm here for the Behavioral Health Community Collaborative in strong, and I would say dire support of LD 592, which would increase the reimbursement rate for outpatient therapy. I know you've heard a lot of bills this session already from us and others in behavioral health and for other services about the need for additional reimbursement. This one too is critical. We are experiencing a time when this service, Section 65 outpatient therapy, was already operating at a loss, and one in which people are experiencing long wait times and long wait lists. Let me just give you data from two organizations. At Sweetser, they currently have over 1,000 clients waiting for therapy services statewide in settings that include in primary care offices, public schools, housing communities, and colleges. In 2019, they had to close their clinic-based therapy program, affecting 450 people. This last year that the program was fully operational, the program had a negative gross margin of 51%. That was direct costs, and when you added in the other costs, it was 66%. Personnel costs alone were 110% of the revenue. In Oxford County Mental Health Services, a rural area, they have an outpatient wait list right now with 75 clients on it with referrals dating back as far as January 11th. Imagine if you are in desperate need of talking to someone and have finally gotten over that stigma of, oh, should I call someone? Should I not? And then finally call and told it will be a 4 to 5 month waiting period for your first appointment. Why? Because there simply aren't the resources to have enough clinicians to see all the people that are in need of service, this basic service that often prevents additional and more expensive and intensive services. Yes, COVID has not caused this problem, but has completely exacerbated the need for services. So some people who have never sought those services before, and the inability to recruit and retain adequate staff to provide the services. We heard recently from University of New England that I think it was less than 10% of their graduates in social work intend to stay in Maine and work because they can get much better rates elsewhere. This is a problem everywhere. It's particularly acute in rural Maine. I know it is painful for you to hear these needs, and it's hard to be empathetic to those who are trying to access these services.
30 seconds, please.
We must face the hard reality that this is a problem, and this is a problem now. Studies and plans are wonderful and important, but to the person who is struggling and waiting, they mean nothing. Please take meaningful action now and pass LD 592. Thank you.
Thank you. I don't see any questions. Thank you for being here. We can, now we'll go to Ms. Shermer. Welcome back.
She's back. So thank you for your sitting here all day listening to all of us, and some of us more than twice and probably more than 3 times. I'm here representing NASW Maine in support of LD 592. LD 592 really is asking to increase reimbursement for outpatient mental health services. I had the privilege to review the 2020 Maine Care Rate Evaluation Study that DHHS hired this outside agency to do, and I was so disappointed to see the behavioral health rates. Number one, all of the health rates were compared to about 5 different other states. The behavioral health rates, at least for outpatient behavioral health, was compared to 1. And the one it was compared to, it was at 74% the compensation to that state, which was Vermont. A 2019 social work survey of over 5,000 licensed social workers in the state of Maine indicates that low pay and reimbursement are social workers' top 2 concerns. And over the years, I have been supervisor to dozens of social work students, and I've had colleagues who have gone into social work. The one story that is most pressing to me was one of our MAs at our health clinic decided that she was going to go back to school, get her master's in social work, and become an LCSW. And I was so dismayed when she came back to me several years later and said, "Julie, I never would have done this. It was such hard work. You do such hard work, and I have such respect for all social workers, but I had no idea how little pay they received." And Paula was at that time a working mother she was single and had 3 children. So I totally urge you all to support Representative Gramlich's bill and support the increase in reimbursement for outpatient behavioral health. Thank you.
And thank you for being here. Any questions? Always nice to see you, Julie.
Thank you.
Any other thought? Okay, so now we can go to Ms. Morris.
Good afternoon, Senator Claxton, Representative Meyer, and members of the Standing Committee on Health and Human Services. My name is Caitlin Morse. I'm a resident of Westbrook and the Policy Associate of the Alliance for Addiction and Mental Health Services. I am here to submit testimony on behalf of the Alliance in support of LD 592, an act to ensure access to outpatient mental health services by increasing reimbursement for outpatient therapists. At the Alliance, our members represent the full continuum of behavioral health, mental health, alcohol, and other drug use and addiction treatment services, and peer recovery supports. This bill would create conditions to increase access for some of the most common and in-demand work our members do. Outpatient therapists provide resources to patients that enable them to learn to cope with stress and manage their mental health. Mental health issues curtail an individual's ability to lead a fulfilling life. They can cloud relationships, family life, and careers. Mental health conditions cut across economic, social, and racial groups. An estimated 1 in 4 Mainers is impacted by mental illness. Every day, the waiting lists for services grow longer. Every day, there are people with symptoms that are increasingly harder to manage. Before COVID, eating disorders, depression, post-traumatic stress disorder, anxiety, and many other diagnoses were treated by outpatient therapists. A national study of emergency department visits from mid-March through October in 2020 found that visit rates for mental health conditions, suicide attempts, drug overdoses, and child abuse and neglect were higher than the same period in 2019. Turn on the news at any time during the day. You won't go very long without hearing about stress, isolation, unemployment, and COVID brain now are just a few of the symptoms patients are handling in the aftermath of a global pandemic. For patients, the stressors may have changed some, but the need only continues to increase. For providers who have already been stretched thin, stagnant rates are another reason to question the work they do, and stagnant rates have lost our state many good providers over the years. Immediate investment will allow us to increase the staffing in our agencies and work through ever-increasing wait lists. At the Alliance, our members work to keep people healthy and secure in the social safety net. As such, we believe LD 592 is a good start to recognizing the pivotal work our providers do. Please support LD 592 with an ought to pass vote.
Thank you for that testimony. I don't see anybody else yet testify in favor. I don't see anybody to testify against. So the last person we're going to hear from is neither for nor against, and that would be Mr. Dixon. Welcome. I think you're still muted and we're not seeing you. The one more important than the other. There we go.
Yeah, I couldn't see myself up there, and I think I'll even let you see my face.
There we go.
Yeah. So I'm a psychologist, and I'm part of Maine Psychological Association's legislative committee, and there are a lot of interesting bills, but I thought I would come and talk a little bit about this one. In many of the sessions, LDs, there's an emphasis on improving the availability of healthcare services, especially with regard to behavioral and mental health needs, and I've seen that in action in the 3 hours or 4 hours now that I've spent here today. And some of the things that the bills deal with are trying to increase services by allowing for telehealth delivery, by addressing situations in which children and adults are in need or being kept on waiting list or receiving interim services that are far less than optimal by requiring insurance. And another thing that I see in some of the bills is requiring insurance companies operating in our state to follow rules that require equitable payment for treatments that are effective and evidence-based, and by increasing the pool of available providers, including by recognizing practitioners with licenses from other states. All that makes very good sense, since receiving the optimal service in a timely fashion can have a positive life-altering effect for a Maine child or adult. I prepared a graphic that I've uploaded along with a transcript of this testimony, and it compares Maine's current reimbursement rates for an hour of psychotherapy delivered by an independent psychologist with that of several nearby states, including New Hampshire, Vermont, and Massachusetts. Without the increase, Maine reimburses less well than those other states. Maine's reimbursement rates for independent psychiatrists are $88. New Hampshire, it's $113. Vermont, it's $101, and Massachusetts is $121. With
30 seconds, please.
Yes, without that increase, you're not going to get anybody from any other state because you're much lower than we're much lower than every other state. With the proposed rates, I think which would bring it to 110. You're fairly competitive. And I assume that this competitiveness will transfer to other practitioners such as social workers. And I believe that it will result in an increase in in-state main care providers, with more therapy services being delivered to children and adults with main care coverage. Thank you. And I'd be happy to offer any, to answer any questions.
Thank you for some of that statistical information. That's helpful to know. Are there any questions for Dr. Dixon? I don't see any. Okay.
All
So
right.
thank you for being here.
And you guys hang in there. I've been here. I've only been here for part of the time, and I'm kind of a dish rag.
Well, we're very close to wrapping it up. Thank you for
Okay,
being
well,
here.
can I do one more thing? I just want to say that that I have a disclosure to make, and that's that when I finally settled back in Maine after completing my degree, Dr. Claxton was my primary care provider before he got a mission of educating educating doctors in a residency program. So it's nice to see you.
Nice to see you, Michael.
Ed, and all of the others, all of you others. I really appreciate the work that you're doing.
Thank you.
Okay, bye-bye now.
Bye-bye now. So at this point, I don't see any other testimony. Do we have any questions to go to Anna? Yes, Representative Craven.
Thank you, Mr. Chair. Actually, I would like to have a comparison for other providers besides psychologists from the adjoining states.
Vermont and New Hampshire, Massachusetts?
Yeah.
Okay.
Or any other state. It's just that I think it would be useful to be able to have a comparison.
Okay. Any other questions of Anna? I don't see any. So we'll thank Representative Gramlich for bringing this forward, give you something else to chew on. And
Like you don't have enough, Senator.
I know. Have you seen?
Thank you all very much for your indulgence. I know what a long day that you've had, and I know the topic is not always an easy one. So thank you very much.
Thank you for being here. Any questions or next steps, Anna, that we should know about? Then I will entertain a motion to adjourn. According to my calculations, we recommit at 9 o'clock in the morning. So
We adjourn for the night.
I hear a motion.
I second it.
All those in favor? High five, everybody. Thank you. Have a good evening.